you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us heal our earth together. Welcome to the brand new world.
A global namaste. Please join us this Sunday on a free global online episode on Universal Health Coverage Day. Health for all is what we're going to be talking about. So tune in on www.healingourearth.com. This Sunday from 2 p.m. onwards, the Greenwich Mean Time. A global namaste from Dr. Lalit, Sodha.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us heal our earth together. Welcome to the brand new world.
A global namaste. Please join us this Sunday on a free global online episode on Universal Health Coverage Day. Health for all is what we're going to be talking about. So tune in on www.healingourearth.com. This Sunday from 2 p.m. onwards, the Greenwich Mean Time. A global namaste from Dr. Lalit, Sodha.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us heal our earth together. Welcome to the brand new world.
A global namaste. Please join us this Sunday on a free global online episode on Universal Health Coverage Day. Health for all is what we're going to be talking about. So tune in on www.healingourearth.com. This Sunday from 2 p.m. onwards, the Greenwich Mean Time. A global namaste from Dr. Lalit, Sodha.
they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into it.
Give the children of our Mother Earth, reach out your hands, let us heal our earth together. Welcome to the brand new world.
A global namaste. Please join us this Sunday on a free global online episode on Universal Health Coverage Day. Health for all is what we're going to be talking about. So tune in on www.healingourEarth.com. This Sunday from 2 p.m. onwards, the Greenwich Mean Time. A global namaste from Dr. Lalit, Sodha.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth, reach out your hands, let us heal our earth together. Welcome to the brand new world.
A global namaste. Please join us this Sunday on a free global online episode on Universal Health Coverage Day. Health for all is what we're going to be talking about. So tune in on www.healingourEarth.com. This Sunday from 2 p.m. onwards, the Greenwich Mean Time. A global namaste from Dr. Lalit, Sodha.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth, reach out your hands, let us heal our earth together. Welcome to the brand new world.
A global namaste. Please join us this Sunday on a free global online episode on Universal Health Coverage Day. Health for all is what we're going to be talking about. So tune in on www.healingourEarth.com. This Sunday from 2 p.m. onwards, the Greenwich Mean Time. A global namaste from Dr. Lalit, Sodha.
they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world.
A global namaste. Please join us this Sunday on a free global online episode on Universal Health Coverage Day. Health for all is what we're going to be talking about. So tune in on www.healingourEarth.com this Sunday from 2 p.m. onwards, the Greenwich Mean Time. A global namaste from Dr. Lalit, Sodha.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world.
The streets have never been so quiet. The squirrels found a new hideaway.
A global namaste.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world.
A global namaste. Join us this Sunday on global online episode on Universal Health for All.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world.
The streets have never been so quiet. The squirrels found a new hideaway.
And gentlemen, may I have your attention, please? The show starts in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, go.
Global Namaste. Good morning, good afternoon, and good evening to all the viewers of Healing Our Earth. We are back again with another episode, a global health coverage episode. at Healing Our Earth. And I, senior anchor and host at Healing Our Earth, Dr. Amrita, welcome you all to yet another and beautiful episode of today. Today's episode is a healthcare episode, which is with a lot of diversity, where we'll be having with us people from different backgrounds, health professionals, who will be there to talk about the health and the importance of health for all. But before we start, let's start with Gayatri Mantra. Your hands together, closing your eyes, taking a deep breath. Om Om Bhur Swaha Tat Savitur Bhargo Devasya Dhimahi धियो यो न प्रचोदयात् Om Bhur Swaha Tat Savitur Bhargo Devasya Dhimahi धियो यो न प्रचोदयात् Om Bhur Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi धियो यो न प्रचोदयात् Om Shanti Shanti Shanti. Welcome. As today's episode is a health coverage episode, we will be talking about different facets of health, definitions of health, what is the meaning of health from various perspectives, and what all strategies should we adapt in our lives to stay healthy and to bridge the gap between the global healthcare systems which are worldwide present. Apart from that, talking about what is good for us, what not, and what is the real definition of health in terms of an individual, and how to counter that. Therefore, today's episode is specifically dedicated to talk just on heal thyself. That is healthy life, and how that health can promote healthy life for us. For this, we will be having different guests today. And first of all, I'm very glad to welcome my co-host, as well as the episode producer, as well as our senior anchor, chiropractor, and what not with me, Dr. Lalit Sodha from London. Global Namaste, a very good afternoon to you, Dr. Lalit.
A very global namaste to you, Amrita. What a pleasure to join you on this lovely session on universal health coverage. A global namaste to all of you.
Same here. I am also very pleased to have you with me today for talking about health, and you being one of the iconic persons in health, how you take care of your health and what does health mean to you. And being a chiropractor, I think it is very important, firstly, to listen to you before we move on to our guests. So over
Thank
to
you.
you. Thank you.
Thank you so much. Thank you so much. Amrita, being a chiropractor myself, yes, I do look after my own health, and I try to
Hmm.
promote what I preach and what I believe in to be healthy. And my basis of health goes all the way down to the core, meaning if you look after the structure that holds you up, holds you
Hmm.
straight, holds you on your 2 feet, well, that's the bottom line, looking after your spine, which is so very important
Hmm.
because the brain and the spine, the spinal cord and the brain are the central nervous system. That is the guarding system of our body that makes us function. If you say that this is an electrical circuit board, well, that's what the
Hmm.
central nervous system is. And I believe that if
Hmm.
you look after your spine in terms of its overall health, in terms of its flexibility, in terms of its nutrition, and in terms of its exercise and fitness, I think you're really looking after your whole body, because by looking after your spine, which houses the nervous system that controls the whole part of the body, well, you're looking at the core of it. So I believe in health as a whole rather than treating just one condition. And health as a whole comes from looking after yourself as a whole. And that is, what you eat is very important. What you actually physically do to help yourself stay fit is very important. I believe in posture, which is equally important to hold your spine in good shape. And I also believe in good sleep, which means your body needs rest to function the next day. And I also
Hmm.
believe in what you are is what you eat. So happy,
Yeah.
healthy food is what's necessary. That's what I look at health as a holistic approach. And I'm sure we have got such an array of speakers today who are going to be telling us about health from a very, very different perspective. So, in a nutshell, that's what I believe in, Amrita. And health is wealth for me. Is what I'm going to say to you.
Yeah. So basically, this health for wealth, as you are a chiropractor, before we move on to our other guests, how much percentage do you weigh that your spine and your posture is so important for your health? So let's cover that aspect a little bit before we move to our other guests.
Okay. Well, if you ask me, I'll probably give you my biased opinion, but I think that's quite a straightforward opinion. It says how much of your spinal health is important for your overall health. I would say 100%.
Hmm.
100%.
Hmm.
100% is what I would say, because if your spine is not working properly, the structure that holds you is not working properly, the health is going to collapse.
Yeah. So that structure, I think, is a pillar ground of everything, which people don't think about.
Absolutely.
That's really great. And can you just recommend two quick tips for our viewers for a healthy spine?
Absolutely. Number one, for a healthy spine, make sure you have your correct posture. Posture doesn't just mean sitting correctly. Now, posture has a very good definition, and if you look at the dictionary, posture is the attitude of the body. That is how posture is defined. Pose, attitude of the body. That is what it's determining. So, number one, correct posture in sitting, sleeping, standing, and walking. Vital that we have the most correct posture, that we are standing on 2 feet rather than more weight on 1 foot and then getting your pelvis tilted. Number one, posture, the best health tip I can give you. And number two is physical fitness. You lose what you don't use. So I always believe that if you keep your spine in a healthy condition by doing exercise, by doing yoga, by doing physical activity to build the muscle strength and then keep it going. Well, those are the two main tips I will share is number one, posture. Number two, exercise. Use it.
Great. These two things are so important. People talk about exercise, they do exercise, but then they don't really put an emphasis on how important is your posture. And it's not just for the fitness enthusiasts. It's not just for the models or for other people who are icons in different industries for their glamour, but it's much more about yourself and having an attitude of looking good in your own self, I think, will help in enhancing your posture. That will help you to stay healthy rather than thinking about what it has to do by my own self, I think. And
Very
that's
true.
that's very good. Like, I think it's a way of life that you have emphasized on for a healthy the spine. And do you think that there are certain particular exercises that people must do for a healthy spine, or they are just general postures that are comfortable enough?
I will certainly share some very good tips on the exercises, but I want to pick up on a couple of things you just mentioned, Amrita. Health is a way of life. Absolutely true, because that is what we should be all having the mindset about our own self and our own health. Health is absolutely a way of life. My motto or my catchphrase is health is by choice, not by chance. So, yes, health
Hmm.
is vitally important. And also, as a tip that you asked me to share with exercises, if one is very much aware of yoga, which is really big these days, then I'm going to say within the yoga cycles, the sun salutations or what they call the Surya Namaskar is vitally important because it really gives your whole spine a lot of flexibility. So if one exercise that you ask me, Surya Namaskar or sun salutations is what I would say, Amrita.
Hmm, good. That's really good. So sun salutations are a key for a healthy spine. That's what Dr. Lalit Sodha says. And we have our founder and director Neil Kumar. Let's hear from him what he has to say about his health and the tips. Over to you. Global Namaste, Neil Kumar. And then we have Professor E. Sharma as well with us, who
Global
is
Namaste.
our
Yeah, hi
Ayurvedic
Amrita.
Global
contributor
Namaste.
and well as the Ayurveda episode producer, as well as he has been at the post of Ayurveda chair at Mauritius from University of Mauritius as well. So global namaste to you, Professor E. Sharma. Uh, Kindly unmute yourself and what is your message for people in regards to health? Over to you, Dr. Lalit Sodha, and let's have a conversation with Professor E. Sharma. Thank you.
Well, a very big global namaste to Dr. Sharma. What a pleasure to meet you online once again.
Yeah, pleasure is all mine, Lalit. Thank you so much.
Wonderful. So, Amrita had a wonderful question about our health and a couple tips that I shared. And I certainly believe that yoga, which keeps the spine flexibility and especially the sun salutations and Surya Namaskar, as we call it, is an essential exercise to keep your spine flexible. Do we share the same thought, Dr. Sharma?
Indeed, indeed. It's so true that we are like getting away from any kind of physical activity. And maybe fortunately or unfortunately, it is the development of technology which is getting us farther and farther from any kind of physical activity. And the day is not far when you might not have to walk to your bedroom. They will invent cars, which drive you to your bedroom, place you on your bed. They help you chew your food. So maybe we could be unfortunate enough to, see that day of technology. That's where Surya Namaskar is one word solution to an extensive kind of physical activity, which is like one size which suits all. Everyone can do it with the varying degrees of exertion and severity. You can do it very mildly and you can do it like very rigorously as well. So goes without saying, Dr. Lalit, Surya Namaskar is one word solution. If one exercise you want to undertake, that could be Surya Namaskar.
Thank you for sharing that same thought, Dr. Sharma. But you know what? I'd love to hear from your perspective also what health is. And if you can define health for our audience and share your tips, that would be so good.
Over the last 2 decades, I am more and more believing that mental unease, a stress, could be a real big hidden trigger for almost every health condition. Earlier, like 2 decades back, we used to study that there are a set of diseases known as psychosomatic disorders, where your psyche will directly lead to dysfunction at your soma, at your body. Some physical diseases will come from your mental state, but now it is more and more believable that not some, rather all the diseases could be emanating from a unhealthy mind. That is where setting your expectations right to be stress free could be a real wonderful beginning which would be suitable to all. And a stress, if we dig deep into Ayurveda, we come to one conclusion: unrealistic expectations is the one word which triggers all kinds of stress conditions. So if we can realign our expectations, from our relations, from our finances, from our health, from our like society, then we could really not be over expecting, and we could be stress free by and large. When we expect unrealistically, when we expect a lot, then that is the beginning of almost every type of stress. So realigning, zooming out, realigning our like expectations, not micromanaging everything, could be one nice beginning to de-stress, Dr. Lalit.
Thank you for sharing that wonderful talk about the psychosomatic conditions and that mind has a very, very strong effect on the body. So, what's going on here is invariably going to affect our body, and that's a very good thought, a very good, I think, a very good health point that one should be taking into mind because from my own chiropractic practice, I can say that a lot of back pain that comes in is because of mental stress that patients are going through. But I'll tell you one thing from an Ayurvedic perspective, how are we going to, or how do you assess a patient and then find out that it is purely coming from the mind, or a mind has the stronger component on the condition? How would you do that?
Yeah. Ayurveda seers, our acharyas, actually oversimplified it for us. Ayurveda is an observational science. It is not an experimental science. It was observational. It is observational. Secondly, Ayurveda is a physics-based science and not chemistry-based. If we go to pure sciences, biology does relate to healthcare from any perspective, Ayurveda or the Western perspective, or any kind of healthcare will involve biology, one pure science. The other two pure sciences, or many from many pure sciences like mathematics, physics, chemistry, Ayurveda is more like physics based. How come so? Because of the gunas, the qualities, the polarities, heavy and light, cold and hot, dry and oily. These are the physical attributes which help us in diagnosing how are your Vata Pitta Kapha placed. Are they out of place? What needs to be brought back? What requires realignment, rebalancing? That is where the physical parameters are very obvious, very easy to diagnose, which gives us a straightforward solution that you have got a lot of vata or pitta or kapha at your mind or at your body or both. This is how we begin our patient examination, Dr. Lalit.
Sure. So now this kind of examination that then you come to your conclusion with your consultation, your examination, that this is where the Vata, Pitta, Kapha are, one is stronger than the other, and then you relate it to the mind causing those kind of problems. Now, this kind of a diagnosis, this kind of a study, this kind of availability to the general public, how can we, or is, to what extent is the general public aware of this physical concept, that such a concept is being used by Ayurveda?
I missed out some of your question because of network issue. Dr. Lalit, if you can come again once more, please.
Sure. So, in a nutshell, how can the general public be aware of the fact that this is the approach that Ayurveda uses to identify and diagnose conditions? And how can we make the
Yes,
general public more aware of this?
yes. It's again very simple. We have got a very basic questionnaire. It's like a 20 question questionnaire. You have to answer like your sleep, your skin, your body weight, your psychology, your reactivity, your digestion, your appetite. There are some like questions, we evaluate you upon these 20 very basic questions, and then we come to know that you are like abnormally high or low in vata and or pitta and or kapha, and that is what we try to bring back to normalcy. And sure, it goes without saying, the most important guiding factor is the presenting complaint of the patient, what brought him or her to us. So the patient might be concerned with he or she is a vata or pitta or a kapha person. That is for our utility. But the patient came to us because he or she has got migraine or arthritis or diabetes or whatever. So that remains our first concern. At the same time, we have to factor in what your body type is. Accordingly, your prescription will vary. If you have got arthritis, that is you have got a vata problem, but your body is kapha, then we have to see that we have to cater to your vata problem, which is your arthritis. At the same time, you are a kapha personality, so we have to consider that as well. That is where Ayurveda goes beyond disease drug relationship, which is the forte, which is the mainstay of the Western medicine. Any kind of headache, paracetamol. Any kind of infection, antibiotic. Disease and drug. The human being does not exist in a Western medicine because of their extreme hard work over last 2 centuries. But Ayurveda still stays very personalized. We cannot say that you have got arthritis, then we have got this Ayurveda herb for you, where the human being does not exist. That approach will not work. That is where we have to see you have got arthritis, okay. Now, what you are you a vata or pitta or kapha accordingly? The arthritis patient I'm treating, if I'm treating three arthritis patients, all have got the same symptoms, but one is vata, one is pitta, one is kapha. My treatment for each one of them will vary. I will not give them the same treatment, the same painkiller, for their arthritis. That will be a short-lived, like respite, a short-lived treatment which would not succeed. That is where we have to deeply factor in the individual, his or her mind and vata pitta kapha, Dr. Lalit.
Well, obviously, there's a very intense way of identifying and getting to the root of the problem. Now, it's great, but let me ask you one thing. How can we then educate the general public that this is one form of healthcare that is available to them and they do not have to ingest all the chemicals which actually in the long run are damaging to your body?
Yeah, indeed, this is a very big challenge. And over the last 20 years being operational in the international arena, I reached to one conclusion that if we start talking about Vata Pitta Kapha, that might not interest everyone. It
Yes,
could be like too tricky for many. It might
yes.
not work out. What we did is we are starting Ayurveda education, Ayurveda preventive health through food. Food will be applying to all. You could be from any country, any culture, any age. Food will be relating to all. That is where dietetics principle is the safest entry. When we have to educate anyone who does not know Ayurveda about Ayurveda without talking about Vata Pitta Kapha, which would be too tricky for some of them, we start with Ayurveda dietetics. You should be eating like this. And this is what we have been doing over the last 2 decades. And we strongly believe no treatment or preservation of health can be possible without routing through these four protocols. Diet is the strongest medicine, then lifestyle modifications, which include exercise, Surya Namaskar, yoga, meditation, de-addiction, etc. Then comes a set of herbs, two or three herbs for you. And the last and the strongest we have got is Panchkarma. So Panchkarma is given to 10% patients only. But we believe if you really want to get rid of your disease conditions or you want to stay healthy, you should be very regularly taking Panchkarma. Now, how much time does Panchkarma take? If you are healthy, we will be taking your 20 hours every year, just 20 hours. Now, 20 hours in 1 year is not a bad deal at all, where we will be resetting your kapha over 2 hours of Vaman therapy, 1 hour into 7 days for your vata, and 12 hours, one go of virechan, purgation for your pitta. We will be resetting your vata pitta kapha, whatever pollution you are gathering at your cellular level. Any machine when operates, it will gather some pollution. It could be your car or it could be any machine. And this human body is no exception. It does gather in the process of living it does get something unwanted, some pollution, which is an excess of Vata Pitta Kapha known as ama. And getting rid is so easy, like 20 hours every year. And the you do not need any expert Ayurveda doctor for that. It is so easy. You can, with very little training, you can do it yourself, and you can give yourself Panchkarma, you can give Panchkarma to your family members. 20 hours a year is not a bad deal, Dr. Lalit, I believe.
Dr. Sharma, thank you very much for a wonderful update. In a quick answer over the next 30 seconds before we move to United Kingdom with Kailash and Sejal, since this is a Universal Health Coverage Day, and the theme this year is, should the government be involved in providing either subsidized health or free health? In a quick answer, do you feel most of the countries should look and provide Ayurveda also free in the healthcare?
Exactly. I do believe Ayurveda should be spreading to more and more countries, and being on the same page. We might not be jumping, to treat difficult diseases. We should be taking baby steps. And that is where, again, Ayurveda Dietetics is one such baby step which will be relevant to all, very powerful. And that is where we can have a very nice beginning. And Mauritius is an example where one country has adopted Ayurveda Dietetics, other countries can very easily follow the suit.
Thank you, Professor Sharma. And for those who are listening, it was Professor Sharma through the Ayush Ministry of India who propagated the project Mauritius, which is a very successful example at the moment. Ish, stay around, because Sejal, who Kailash will introduce, is a good exact point, because she's going to discuss partnerships between the government and the faith-based organization. Again, a very relevant topic. So Dr. Lalit Sodha and Dr. Amrita Sharma in Jalandhar, let's welcome Kailash. And Amrita, you got an announcement as well for her. Each stay around and we'll chat with you in a moment. Over to you, Amrita.
Yes. Thank you. Thank you, Neil Kumar. Thank you, Professor Sharma. Dr. Kailash, we all wish you a very heartiest congratulations for your graduation with doctorate, and may you get many, many laurels again. From all the Healing Our Earth family and the viewers, a very good luck and many congratulations. So here we are with you. And we bless you that you keep progressing in life, adding up more batches, and keep sharing with us all that wisdom that you have achieved. So many congratulations on your achievement.
Thank you so much, Amritaji. Global Namaste to everyone. And thank you for allowing us to come and share our thoughts, our experience in a very, very important subject today. And I'm very delighted to introduce my guest today. I've got 4 guests who come along from the north. Well, two of them are from the northwest and 2 are from the south. So first of all, I've got our Professor Sejal Saglani from London, who's kindly come along to speak to us about a very important topic here, about the partnership between the government and the faith-based organization. And I believe that Professor Saglani's got some slides to share. So if Amritaji, if you can allow her to share, please. Thank you.
Yes,
Over to you.
thank you.
Thanks very much, Kailashman, for the invitation. Thank you all very much, Namaste, for inviting me today. I'm going to talk to you about the importance of partnering with different types of organizations to help our community to improve their health and well-being. Yes, I am a professor of pediatrics, and that's my day job at Imperial College London. But actually, I'm talking to you as a volunteer for BAPS Swamnayan Sanstha, UK and Europe. I'm sure you've all heard of BAPS, and I lead the healthcare work that happens there. So I just want to tell you about some of our activities and give you some ideas of how faith-based institutions and other various partnerships can really work well in a very economically efficient manner to improve the health and well-being of of the South Asian population particularly. So what are the aims of BAPS Healthcare? Well, really, our aim is to raise awareness about common health conditions that affect our community. All the work is delivered and led by volunteers. We have numerous healthcare professionals at BAPS. They all really abide by this concept of selfless service and seva and selfless giving. That's kind of the ethos, and that's what makes this all really rewarding for us all. Our headquarters are in Neasden in northwest London, the Neasden Temple you can see here where we are based, but actually we've got centres nationally, and that's how I know Kailash Ben. We've got centres across UK, Scotland, Wales and Europe. So really our aim is to provide practical help and guidance about health and well-being in a culturally sensitive environment. That's how we really get people to engage. We speak the language, we understand what's expected, and that's how it's kind of received quite positively. We also give guidance about, like in the UK, obviously not everywhere in the world, but in the UK, we're very lucky to have the National Health System, which is free at the point of delivery, but not all of our community know how to access the services that are available. So a lot of our role is to actually signpost and make sure people are making the most of the services available. So what are the activities that we do? This is just a snapshot of the work we're doing. Health awareness seminars. We've been delivering these for 25 years, and they're very targeted, achieving a healthy lifestyle. Cancer awareness, prevention is a real core to what we want to do. We want to actually prevent anybody getting ill. We want to promote healthy lifestyle and prevention of illness. So uptake of screening services for cancer, which are available in the UK. We're encouraging our community to actually go and get the screening done. We do antenatal classes on site, and we have specific sessions for specific populations, and awareness for the elderly is one key thing that we do. We've been doing a lot of screening for cardiovascular disease and diabetes because, as I'm sure you all know, the South Asian community is a much higher risk of both of these conditions: high blood pressure, heart disease, heart attacks, diabetes. And so we're screening on site at the mandir, but also out in the community, in various community centres and with other community organisations such as the Oshwal Centre for Jains and the Rotary Club. And the key is that in our community, these diseases start much early than in the Caucasian community. And so we're starting screening under 40, whereas for others it would start as 50 and above. And this is just an idea of the amount of work that we've done. We started in 2005, screening early, over 3,500 when I made this slide. It's higher now. And we give a really comprehensive screen of height, weight, blood pressure check, blood and cholesterol checks, really giving people an idea of their risk of diabetes and heart disease, including a consultation with a health professional who would be one of our volunteers, and then signposting and advising as needed. And this work has very nicely been recognised by the government. That's why I wanted to talk to you all today. So the local council, Brent Council, gave us an award for the Community Project of the Year for the health awareness work that we've been doing. And as a result of that, we've managed to get subsequent funding from Brent, which I'll tell you about, to continue this work in the community. The other organizations we partner with are charities. They have a lot of money for outreach work, going out into the community to raise awareness about various conditions. So we work very closely with, for example, the British Heart Foundation, Diabetes UK, and Macmillan Cancer Care, all to really do our best to raise awareness about these really common conditions in our community, make sure people aren't scared of all these things, and they'll do the stuff that's on offer and make the most of the services available. Another aspect where we've partnered with the government, NHS Blood and Transplant, is to promote organ donation. So in the UK, we've recently had a change in law, and it's become an opt-out clause to become an organ donor. But our community don't really know what that means. Should we be donating organs as Hindus? Is that right or wrong? So we've made the most of our faith background and what's the belief in Hinduism about organ donation, absolutely promoted. And we've made leaflets that are really sensitive to our religion, to our culture, so that people feel comfortable about making decisions about organ donation, both living organ donation, donation after death, and bone marrow donation. And this is our project for 2024. We very recently received a grant from Brent Council to promote wellness, and we called it BAPS Wellness. And as you can see, the NES from the wellness represents 4 key aspects: nutrition, exercise, stress management, and sleep management. So as we've been discussing, it's actually a holistic approach. We didn't want to call it mental health because often in our community there's stigma around that. But so what we've said is let's call it sleep management and stress management. And then the physical aspects are nutrition and exercise. This project started earlier this year in the summer. And our aims are to give very simple and practical guidance to improve the physical and mental well-being of our community. And what we're using is the concept of habit forming. So we're trying to say to everyone, make a small change and just keep with it. Make a healthy habit, and soon you'll be into a healthy lifestyle. And so the NES is nutrition, exercise, stress, and sleep, targeted advice for different ages. This is across the age range. And one of our key outputs so far, we've got some really talented volunteers, including nutritionists, is we've made a vegan and vegetarian recipe book. Key being it's a sattvic vegetarian diet, which is what we in the Swaminarayan religion would practice. And it gives nutritional information, and it gives lots of tips and tricks about how to make our Asian, Indian vegetarian diet healthy. So many meal swaps and things that we can make. And that is being reinforced with talks by experts. So we've had webinars from experts. The first was from Sujata Din. She's a health and cancer coach, and she talked very much about nutrition, how nutrition can be optimized for our health and well-being. Just last month, we then had a talk in line with World Diabetes Day from a consultant diabetologist. She came as a volunteer and delivered a webinar on understanding diabetes, both pre-diabetes, once the diagnosis is made, and then monitoring diabetes and keeping it well controlled. And myth busting is a real important thing. You know, all these things that people sort of get told about, are they true or aren't they? So that was in November. And then just a week tomorrow, we've got our next webinar. And I'm really glad we've been talking about movement and posture, because that's exactly the focus of our next webinar. We have a physiotherapist who's going to be talking specifically about how to improve posture, ergonomics, and building strength. Muscular strength is key to staying well, and it's going to be tailored for all ages. So that's just to give you a taster of what we're doing. So why is it a good idea to partner with various organizations, but specifically with the government? And how can a faith-based organization really make the most of a partnership and the most of the money that's on offer? Well, in a faith-based organization, we're able to portray our messages in a very culturally sensitive manner, the diet that we're used to, in the way that we live and the way that we believe. We can promote all of our health messages in that context. It's in the mandir, so, you know, a real environment where people feel that they're trusted. And the advice is tailored to allow for religious and cultural beliefs. The volunteers provide much of the work, so it's actually really good value for money, because one of the most important resources, I'm sure you'll agree, for the NHS and the government is actually paying salaries. This way, it's very minimal salary, and we can deliver a lot more. We tackle myths and false messages to make our community healthy and believe in how to become healthy. And the last point is really key. Our health messages are reinforced by our spiritual leaders. So the head sadhu for BAPS UK and Europe is absolutely behind this program. And in fact, our spiritual leader and guru, Puja Mahant Swami Maharaj, who's based in India, also is really behind all of this. And this is just one example of how much he supports the work that we're doing. When we launched our organ donation project, he was very happy to have an official opening of the leaflets to really portray the message that what we're saying is in line with Hindu beliefs and our value systems. So that's it. Thanks very much.
Thank you so much, Professor Saglani. That was very informative and very insightful, very helpful for us to follow up all the leads that you've given us. and the importance, like, we just heard Dr. Sodha and Dr. Sharma telling us about all the holistic approach, and here you are presenting those, and I'm so pleased to see that there are seminars available online for us to access as well. So thank you so much for the information. I'd now like to invite our next speaker, Mr. Ravindra Shah, and I noticed that Dr. Gupta is with us as well. And they both are doing a wonderful, fantastic job in Preston promoting health awareness through health mailers. And they've been working in the communities with organizations in communities to bring people together to raise this awareness. So I'd like to pass you on to Mr. Ravindra Shah to enlighten us on this topic. Thank you.
Thank you very much for inviting me to this webinar. I'd like to endorse what the previous speakers have said, and we are doing exactly what they've all been saying. Basically, is empowering the community to take charge or control of their health and well-being. And I see a professor in London has been doing that for 25 years. I'd like to invite Ramesh Gupta to come on board as well, because he may have something to say, something regarding the health mela, because he's our chairman. And as Professor has mentioned, NHS in this country is free at the point of delivery. So I don't know whether I can load some of my slides. Would I be able to load it on? See if I can.
If Amritaji, if you can give Mr. Shah access to.
You are made a co-host, so you should be able to. You're a co-host.
I'm just trying to.
If you look at the bottom green button, which says share.
Yeah, I've clicked on that.
Yes. And now you'll have to find your PowerPoint. Okay, maybe you can just talk about it. It's fine, because we'll be moving on to next guest.
Okay. Well, basically, if I can just open my PowerPoint. So basically, what I wanted to talk about is the people of ethnic minority, which is already covered, that, behold these melas in a non-threatening environment, which is a sensitive manner, and the language, which is preferably in their own language. And we started this about 25 years ago. We started with the monthly talks, which covered cancer, diabetes, kidney, obs and gynae, lipid profile, and all that. And then we decided to have an annual health mela, which we started in 2001. We started from the temple because the people of ethnic minority found it difficult. They knew the services are there, but they just didn't know where to access them. And so we were giving this information to all the people in the community. But then again, we thought, why not do it for the whole of the population of Preston? And so we started our first health mela in 2001. And the exhibitors were from hospitals, volunteer sectors, social services, and all that. Also, we had complementary medicine included in the health melas. And normally we have 60 to 80 exhibitors, which attracts the hard-to-reach community, people who would not normally go for their health MOT to their GPs, would come to the fun-filled event. So these are the starting point of it. And we do the screening as well. We do the glucose, lipid profile screening, and other screening as well, BMI, and then Q risk scores. And we do these results in triplicate. So they have a result. We keep a copy. And the third one is if their results are abnormal, they automatically go to their own GPs. I think I've been cut off. Have I been cut off?
No, we can hear you.
All right.
You're loud and clear.
I'm just trying to join
he wanted to see his face.
Not really.
Okay,
Yeah.
good.
So basically, this is the main points, and we've been running it for last 25 years. I don't know whether Professor Ramesh Gupta want to.
Yes, Ramesh Gupta is here. He's not
Yeah.
unmuting. Ramesh,
Can you unmute yourself, Ramesh?
Well, I think you have covered most of the thing, and I'm delighted to join this, that the previous speaker and you are really engaged in the activity where the public is at the center, to be honest. The whole concept is that the health should be the in charge, the in charge for the health should be the person.
Yeah.
And most of that is education. And so far, the health has been taken away from the community to the areas in the hospital and clinics, which is the gray sort of area, and where the public is not empowered. And public can be empowered only if we move to the community, we move to them, we listen to them, and we work together. And that is what the National Forum for Health and Well-being has been doing for 25 years. And we started in Preston. We have gone all over the Lancashire, Cumbria, Yorkshire, and the other parts of the England, including London. And we have advised in Wales as well. And we have gone to Libya and to host country India. So I think, as we say that what we say that we listen to the public, we say that what is the problem. The problem is the understanding, the knowledge, because it is not that because they can't speak English and they can't communicate with the GPs, that's why they are not getting the good service. It is all about the baseline education and baseline knowledge of the patient. That's what we are trying to raise. And we have been quite successful in that this thing. I think this is not my this thing, so I will allow the speaker to continue.
No, you've done it very well, Ramesh. And basically, just wanted to say that this is our flagship, and other towns and cities have emulated our model for doing the health melas. And I'm very pleased that BAPS is very much involved. And I think we need to try and keep in contact with the Professor Sejal and see how we can, expand our forte. Basically, the key message is taking control of your own health and well-being. We can guide them, we can direct them to the services available, but basically at the end of the day, it is their responsibility to take control. Thank you very much.
Thank you so much, Naveen Bhai and Professor Gupta, for enlightening us and talking about a very important topic, taking this health out to the communities. And I know from experience that you have reached out to so many families and made an impact and helped those to raise awareness and, lead a healthy life, make those choices, healthy choices. So thank you so much for that. We do have Mr. Deepak Bhai here.
Sorry, can I just interrupt one more? Basically, we also wanted to take out the pathology from the hospital environment to the community. So basically, more community services rather than hospital-based services. Thank you.
Absolutely. Now, that's a really important point. A lot of families do not want to go into hospitals. So, doing this in a very safe environment like mandirs and community centers have been very, very productive. Thank you so much. Like I said, we have our regular contributor, Mr. Deepak Bhai Varand, who's here, and I'd like to call upon you, Deepak Bhai, to give your comments on what you've heard so far before we go on to Dr. Madhu Bencha.
Global namaste to everybody. Thank you, Kailash, for the fun introduction, and a big congratulations as well on your doctorate. So all your hard work has paid off, and long may it continue, should I say. Yeah, thank you to all the speakers and contributors. It's very nice to see that everyone's taken time out and to share their expertise and knowledge. One thing I did reflect on whilst listening was the fact that you're all experts in your area and you're able to so nicely distill all of the key points. So I was actually taking notes whilst listening because it's just done in such a nice way. And yeah, I agree with all the comments that were made. I think certainly the point that I was asked to sort of reflect on was our NHS and sort of governments. Well, you know, in the UK, certainly healthcare is free, and it was obviously mentioned, you know, at the point of access by Professor Sejal. And, you know, at the moment, you know, we know the UK is struggling. You know, there's always this talk about the black hole. And I think when I last read, it was probably a cumulative underspend of sort of 425 billion. I think that was since 2009. So, you know, it's a hard thing to try to cover. And certainly, you know, as a sort of metric, how do we measure this, how we perform compared to sort of other countries in Europe? And I think at last check, it was probably something, you know, as a percentage of the GDP, and certainly is lower than comparable countries in Europe, etc. So these initiatives that happen within communities is definitely good because A, it's targeted, and B, you've got more focused and accessible healthcare ideas and initiatives, and certainly something which can be signposted through various community centres, temples, etc. Just probably as an example, we, as our own organisation, we have a ISA Seva arm which does this type of thing, including sort of helping to feed homeless, but also community outreach when it comes to checking simple, well, we say simple things like blood sugar, diabetes, possibly cholesterol, you know, just other bits which perhaps, as one of the other speakers alluded to, people tend not to want to do because they may not be aware, or they may be scared or worried how they can access this type of healthcare, or may not even be aware it's available. So yeah, you know, as a country, we certainly for our community, I feel those that know will access, and will probably, those who suffer from sort of heart disease and diabetes, which is common in our community, will probably be plugged into the healthcare system, and those that aren't will probably just be suffering for unnecessary for a long time. And it's only until an event happens that they do end up accessing this type of healthcare. I think it's probably important to note that as a country, yeah, having free healthcare is something which has been a key feature of sort of living in the UK, and it's recognised as an institution. However, it's struggling in most areas, and so when I was reading, also uncovered that, you know, another measure or metric was probably the price per person has dropped since the pandemic. Even though the money that's been pumped in has gone up, the demand for healthcare has also gone up. So it's a difficult juggling act for, you know, the country to be managing this type of issue. And I'm not sure we've got a short-term solution. However, working with community members and groups will help, I think, in the short term, and possibly pave the way to sort of longer term strategy. And yeah, the point made by Dr. Sodha was sort of you're in charge of your health. And I think that's probably the starting point. So you look after yourself. Why wait for the issue to happen and then pick up the pieces? So there's quite a kind of a bit of a mishmash of different sort of ideas and concepts. But yeah, certainly you need to be in charge of your healthcare. Us in the UK, we're fortunate we have healthcare available to us. Not everybody knows how to access that healthcare. However, having these types of events and also outreach, community melas and so on are good platforms for all devotees or just members in the community to be able to get this help or be signposted. So thank you very much for giving me the opportunity to speak. We have an aging population, so I don't think we're going to be able to reverse any trends just yet. But yeah, this is the right approach, I think.
Thank you so much, Deepak ji, for that. Thank you for sharing your reflection. And as you said, it's very much about a collective effort and doing so much outreach. And again, we've heard so much from our guest speakers today about the health mailer, and Professor Saglani also talking about the initiatives, the faith-based initiative, working with NHS. It's the way forward. Thank you so much.
Kailash, just before we let you go, Deepak, thank you always for bringing spiritual angle, because that is very important here, as Dr. Lalit Sodha shortly will agree with you. Now, before we move to the next sector, where we are going to talk to Lalit and few guests and Juliet, who is ready, who is a very senior chiropractor here. So we will chit chat. Kailash, I want to ask you one question.
Yeah.
Do you think that the National Health Service of United Kingdom should involve more of the alternative and integrated health services into the practice?
Absolutely. This is something that I've been having a discussion a very long time ago when I was working at Preston College in the early 90s, where we were actually trying to introduce yoga classes, and there was no awareness of yoga or alternative, practices. And that's where, Ayurveda practices, yoga, all those, alternative, therapies and things was something that we were having a discussion about. And I very much strongly believe that this should be part of the mainstream that we can offer. We can offer, like we said, it's our health, and we should take health in our own hands, and we should have choices, not putting all these chemicals in our bodies. We should be able to do it in other non-chemical way, basically, in alternatives.
And Kailash, earlier, Dr. Lalit Sodha mentioned very clearly, health should be a choice.
Yeah.
And which was a very salient point that you picked up on. And earlier, Ravindra Shah was mentioning about Health Mela, and Ramesh Gupta, who is part of Healing Our Earth. So for those, if you want to know the activities that they do, it's an organization called NFHW. I repeat, nfhw.org. That is what Ravindra wanted to show us in the PowerPoint, the kind of melas that they do. And you don't have to speak English, because they involve ethnic languages of South Asian. So it's basically a South Asian health action which they promote over there. Visit this website called nfhw.org, and you will get plethora of information, which will be very beautiful. Deepak, so how important is spiritual angle in healthcare? And since this is a Universal Health Coverage Day, do you think spirituality in some form can help for the propagation of better health?
Yes, Kumarji, I think it all stems, well, for us as practicing Hindus, we kind of see it almost like the analogy with the spine. Everything comes off that, it hangs off that. So if your spine is in good shape and is operating properly, I like the example of electronics and sort of nerves and so on, which is what it is anyway. Then everything kind of comes off that. So, the whole idea, it's very holistic. So, obviously the conversation about nutrition, exercise, sleep, mental health, All of these things fit in. So, from the Vedic points of view, so you've got the concept.
Thank you. Thank you, Deepak. Kailash, you mentioned Madhu Shah, but she's not signed in. We can't see her here. Do you know?
She's here with Mr. Ravin Shah, who's her partner, husband.
Oh, well, if we can give her for next 5 minutes, she can just talk. I will bring her in.
Yes.
And we move on to the next slot. So, Dr. Lalit Sodha, what do you think of it so far? And let's call Madhu in as well for about 5 minutes before we go to Smiling Juliet.
Sure.
Some more
You
points.
know what? So far, absolutely amazing information that has been shared. Big high five to Professor Sejal Saglani. I think the presentation was outstanding. The content was outstanding. And I want to meet you so we can discuss on this further. I think it was wonderfully done and absolutely a way forward for healthcare and individuals who believe that they should be healthy.
And
So
Lalit,
thank you very much for that.
Lalit, as Sejal said, that BAPS are very prominent. In fact, it's still the largest iconic temple of Europe. And that's where all the big Diwali and the Anakut takes place. But they also do health outreaches, as Sejal mentioned. And it is in a blessing, not just from Mahan Swami, the local head over here for Europe, Yog Swami, also promotes all this as the Satyavrat Swami, and Sejal knows very clearly who they all are. So Sejal, a wonderful presentation. We want to promote that more and more. BAPS are, of course, part of Healing Our Earth as well. Lalit, let's listen to Madhu just for a few moments.
Yes.
And then I want to introduce to Ravindra, Kailash, Ramesh Gupta, our yoga guru from Scotland, Sam. We will say hello, and Sam will come back again with his own session. So Sam, stay around. Madhu, unmute yourself. And what tips have you got for us on this Universal Health Coverage Day? Madhu, unmute yourself, please. Over.
Hello.
Yes, we can hear you loud and clear. Go ahead. Over.
Thank you very much for having me on such an important global platform. And I am really feeling fortunate to be on this platform because I am speaking for the first time with a good encouragement from Kailash Ben. Now, I won't take no more time because I have got a very high fires. And I have worked, I came in this country in 72, and as a topic which was given to me was women's health. So it is a huge topic, and you don't know where to start and where to end. Because a woman, she is the pillar of the house, she is the mother, she is also in the society, and lot of expectations are there by everybody. Sometimes she feels frustrated, and sometimes she feels obliged to give the services as much as she can. Right. Now, I worked in anesthesia for about 19, 20 years. And after that, my main subject was women's health. Now, women's health can start from contraception, gynecological, but mainly I think our base now is the women over 50, menopausal women. And I should not diverge myself to the men's health at all. But what we say, the menopause can happen to both partners. So we have to understand each other and also take it with strengths, how to know the mood of each other, how to know how to keep the family also in a nice and a sane, peaceful way, providing the requirement of everybody. So single-handed person, you can't do everything, but you always try within your limits and work your way up. So, as I say, that there are so many facilities available in NHS, like say for menopause, which is around 50, and there is a risk of osteoporosis, osteopenia, and also the further risk of fractures. So we try to prevent with the help of different modalities as well as our own. But as Deepak Bhai and all others said, what is health? It's not only the physical health, mental health, physical health, and spiritual health, which is a spiritual health in my language, is a me time, which is a very, very important time to keep yourself in a peace, nice way so that you can organize your day and provide within your limits. Thank you.
So that was a very good input. That was a spiritual, cultural input from Madhu.
Yes.
And what
And
Madhu is trying to say, that if you empower women, then you empower a better humanity, which is so true. Because the mothers are pinnacle. They are not just wives and mothers and daughter-in-laws and everything. The world revolves around it. So Madhu is a very good point. Madhu, you mentioned menopause as well. So next week at Healing Our Earth is the menopausal care episode for the women. So Kailash will be in touch with you and Sejal, because Sejal, overall, you also understand that as well. You're of course young, but I'm sure you've got some tips as well. And Madhu, you have got some tips. Kailash, you have got some tips. So next week's episode is very good because at Healing Our Earth, we love bringing facilities, tips, and outreaches for women too. So that if we empower women, as we say, we empower better communities. So Kailash will be in touch with
And
you
their husband.
and Sejal. Will be useful. Lalit, what do you have to say what Madhu said? Because it was completely different angle. It was a cultural, spiritual, and in real life experience.
Practicality.
Highly agree with the spiritual side, every angle that she's mentioned about healthcare. And I think a lot of times we forget that element of spirituality, which is so vital for a well-being personality. So, Madhuben, lovely point, lovely presentation, short, sweet, and the message was strong.
Yes, and I would definitely say, in spite of being doctor, I will say, because God has given the strength, and I always say self-help is the best help, and you are the judge of your own body.
Wonderful.
Well, there you are, Dr. Madhu, from experience, from spirituality, from culture, from being a woman, is saying you can help yourself. Trust yourself, believe in yourself, and you can see how you can enhance. So, Lalit, I think it's time to move to our next sector. Just before we do that, let's say hello to Sam and Kailash, because you are in north of England as well, and Sam travels near there because he's in Scotland. Global namaste to you, Sam, in Scotland, and how are you?
Namaste. I would like to add about the spirituality. And you have a body and the mind. The connection is the breath. Breath is the bridge between your body and the mind. If you're frightened, your breath changes. The breath is the way to connect with your mind, which is subconscious mind and conscious mind. Once you connect with that, then you connect with your soul. Once you connect with your soul, you know who you are, what's the purpose of life, then that leads to spirituality. Going to temple or going to Gurdwara or church, you don't get spirituality. First, you have to find yourself, who you are. Once you find the God within you, then you know all God is just in all of you. Then we all are there's more peace in the world as well.
So for those you want to know more about it, Sam is going to come with his own session at 4 o'clock GMT UK time, and he'll tell you more about it. And what he said was, find yourself, then go to the temple, feel your God, will be able to meet real God, and you will be able to resonate with God from there. Sam, stay around. And Kailash, we want to put you in touch with Sam and the northern people, and including Sejal while you are here in London. You've got Swaminarayan temples everywhere. And Sam was one of the integral part for PYPT, which is what he lives, which is Swami Ramdes Patanjali Yogpith. So Sam, we're going to come back to you. Stay around. And Kailash, once again, congratulations. Apart from being an MBE and now a doctorate and community leader as well. And of course, you are a resident contributor and a producer at Healing Our Earth. So double congratulations from everybody at Healing Our Earth.
Thank you so much. Thank you. Thank you for all the lovely good wishes. And I'd like to say a special thank you to all my guests for making time on a very busy Sunday to come along and share some important, information about health. So thank you again. And I hope that you will also be able to support us in our future sessions on, this wonderful sessions that we have each week organized by Healing Our Earth. So again, thank you so much on behalf of Healing Our Earth. Thank you.
Thank you, Kailash. Stay around. We are going to go on an exciting journey from one very senior chiropractor and a reporter and a producer at Healing Our Earth to a smiling and ready for the festive season. We move over to Juliet and Lalit. Let's introduce Juliet and let's get some more chiropractic tips. Over to you, Lalit Sodha.
Thank you very much. What an amazing, outstanding presentation thus far. We've been into it about an hour, and the amount of information we've had is outstanding. So here we are with our lovely Dr. Juliet Hobson, who is a chiropractor, full-time practicing in Northwest London. And Juliet has got some wonderful health tips. But before, Juliet, let me welcome you. Before you start saying anything, let me welcome you on Healing Our Earth with a big global namaste to you, Juliet.
Thank you. Thank you so much. I'm really honored to be here, truly. Yeah, thank you so much.
Most welcome. You
Yeah.
know, your input on this one is going to be very important. But while you were on the session, they were talking about women empowerment, and Mr. Nil Kumar mentioned one statement. He said, "Empower a good woman, and you'll empower the whole world." What do you think about that statement, Juliet?
I totally agree, of course.
I knew you would say that.
He knows what to say, right? Yeah, it was, yeah, I mean, yeah, listening to the lady, I can't really apologize, I can't remember her name, but Ravinda, I think, she was talking a lot about women's health as well. And of course, you know, often we think the men are the ones in the lead, and they are, but the women are always there as well, you know, actually to giving them the nudges, steering the conversations, and we are just as important. So yes.
So I'm going to ask you a couple questions.
Okay.
Yes, we talked about health tips, which is all nice,
Mhm.
but today's topic is on universal health coverage.
Yes.
So really, from being a chiropractor, you've been in practice for what, 20 years, almost 18 years now?
Yes,
Yeah.
over 20 years, yes.
Over 20 years. So your experience with chiropractic and helping patients, and I want to ask you a very, very specific question. Chiropractic currently is on a private basis, that it's available to patients who pay from their pocket or covered by medical insurances. What is your thought process on having such a healthcare facility that is available on the National Health Service?
I think my immediate thought is always that it would be, it's great to give patients the choice, and so that would mean yeah, making it available on the NHS. Absolutely. It's always been my gut reaction. Even it brings me back to when I was looking at studying chiropractic, and this was back in the 90s. And when I was applying to college and I was doing my research at that time, there is actually a really big study that's still used in research. It's a Mead study in 1990, and it's a UK study, and it showed that chiropractic could save the NHS money because it leads to less back care surgery, and it means that people are also going back into work often faster than if they have conventional methods of care. So this is one of the pushes behind it, but there are many different things, obviously, that we have to think about when considering chiropractic on the NHS. Yeah.
Yes, Juliet, you're very right. That study by Professor Mead was conducted at Norfolk Park Hospital.
Oh my goodness.
Yes, it was at Norfolk Park Hospital in Northwest London, and
Yeah.
that study actually proved, and it was published in the British Medical Journal in 1990, saying that how effective chiropractic treatment is compared to the 3 other modalities of care.
Yeah.
Also, how much time was saved by the National Health Service, GP visits, the cost saving based on that.
Yes.
The time off taken from work was also much less. So really, it's very much a proven fact that chiropractic should be available under the National Health Service. Obviously, from our perspective, it becomes one of those things that, okay, people who can afford to pay for it will get it. People who can't afford for it, cannot get it, which is the sad side of it, because the people who can't afford probably need it the most. Would you agree with
Yes.
that?
Yes, I would. But I think it's about options. I mean, there's always a place, and it is about offering the thing with chiropractic is offering that holistic care, like has been talked about a lot already by people here, talking about the body and mind aspect as well. And we know that when you have chiropractic care, that it affects your nervous system, which is affecting then going up into the brain and deeper into your mind. So there's more evidence coming out, especially in 2024, of the neural activity is being changed in the brain when you have chiropractic care, and that's going to be different to when you even have, say, other modalities such as taking drug therapy, or even other more specific therapies like physiotherapy. Yeah.
Wonderful, wonderful. Yeah. So, in your experience with healthcare, what would you say is currently, when we're looking about universal health, what do you think from your perspective is affecting the patients the most? So if you were to pick up on the year 2024, which comes to an end very soon, what do you think has been the most common thing that's been affecting your patients?
Most common, I'm not quite sure exactly what you're aiming for
most
here.
of your patients are coming in with
pain.
What type of a condition? But they're coming in with pain, yeah. So it's mainly low back pain?
Yes, mainly low back pain, but often what goes with that is, it is pulling them down. They're feeling low. Their energy is low. They may have fatigue as well. So yeah, mainly pain that people do come in with. The majority of the time, yeah, low back pain, neck pain.
Yeah, and your recommendation, if you were to give, say, 3 wonderful tips to the audience from what you've been seeing over the year 2024 with back pain, what would you tell the audience that they should be concerned with? Or 3 health tips is what I would say. If you were to give them tips, what would you tell them?
Gosh, putting you on the spot, there's so many things I could go into. So if you're coming in with pain, I would say, really to think as proactively as possible. Your mindset, number 1, is really important. To believe in yourself and to believe in that place where you don't have to have the pain. Number 2 is to stretch, and number 3 will be your chiropractic care. I think those will be the 3 things.
Wonderful. Julia, thank you. Because you know what? You've actually echoed a couple of those points made by our previous speakers, like Professor Sharma, who is an Ayurvedic specialist. He actually mentioned about the idea of having a positive mindset, because what happens in the mind actually goes on in the body. So yes, having a good positive mindset is vitally important. And as you see from Professor Saglani's presentation, I don't know if you were there at the time, they are encouraging activity, exercise to maintain good health.
Yes.
They're having outstanding outreach with all that. So yes, that is good. Now, in terms of women's health, being a woman, empowering a woman, changing the whole world. Okay, so tell me one thing, from a female perspective, what advice would you be giving to all the women for their better health?
The hardest thing, but the most important thing for women, is to look after themselves, and to make time to look after themselves when they are the ones who are often the carers, whether they're looking after elderly or whether they're looking after their own children. So that would be my big one.
Well, I think you're probably the best person to talk to, simply because you are a mother of 3. May I say that?
Yes.
You are a wife also at the same time. You're working full time, and you actually have other responsibilities in life because you want to pursue your interests.
Yes.
So this is juggling. It's a juggling game.
Yeah.
How do you, as a working woman, try and balance all this out?
I think I find it very easy to to do the caring part. Like I think from my perspective, I enjoy the looking after the children part. So giving myself away, as I do with my patients as well, I love doing that, and I often have done that first, I will admit to. But for me, it has been about prioritizing, putting time in to look after myself. But I have, as the time has gone on, I've made time to do it. And I think that's just the main thing that I have it in a routine now. But there are times when I can't fit it in and things like that. And I go with the flow. I don't give myself too much of a hard time. I'm just kind to myself. But also I think on the subject of women and our energy, and it does change, we're not always in high energy. And I think I'm someone who, if my energy is low, I'll go with that for a bit. So I don't try and push through too much. I do try to listen to my body. So if I need a more of a quiet time, I'll try to have a bit more of a quiet time, and I won't go out, or I'll have less on. So I hope that's I do. Yeah. And I think that's important for every woman as well. Yeah.
Very important, be it a woman or a man. I think you've got to listen to yourself. You can't overstress yourself, because stress, as itself earlier was mentioned, stress is a silent killer too. So I think from a very good perspective, you've said, listen to yourself, slow down if you have to, don't beat yourself up, but do the right thing. If you need to sleep one day, take that little sleep, nap it out, and then up and about.
Exactly.
Juliet, I'm going to ask you also one more question, and I think I know a little bit about this, so I'd like you to share it with the audience. You actually look after yourself in a very good way. You're healthy, you eat well, you exercise well, you have your regular chiropractic care to keep your spine healthy. But there is one more thing that you do in terms of maintaining your health. And if that's one thing that you would like to share, and if you tell me online here, I'm going to nod and say, yes, that's what you do. What is it that you do to keep yourself healthy?
As my extra,
yes,
I do practice hot yoga. Is that what you're?
Thank you. And you can see the professor from Scotland. He's super excited, Mr. Sam.
No, I love yoga. I've done a lot of yoga through pregnancy. I did a lot of pregnancy yoga. I've had some amazing teachers. And I have practiced yoga on and off. So, and I love yoga because it's not competitive. You can, you do it at your own pace. So I love that about yoga, and I find it transformative as well. So yeah.
There you go. It transforms you. And Dr. Kailash is also very excited about it. And Sam is also very excited, because yoga is vitally important. And just to share this with the audience, Juliet and I work together as chiropractors. So I know her lifestyle is so good and how she balances everything. And that's why I just wanted to bring her on this particular session to actually inform the audience on how you can balance, and don't beat yourself up if you can't do it. But if you have the right mindset, you're always progressing. So Juliet, that's wonderful. You shared this wonderful topic about a woman from a woman's perspective, but you've even given us wonderful health tips. Here we have Dr. Kailash Parekh, and we have Sam from Scotland. How are you going to give your input to this? And so may I ask Dr. Kailash Parekh to give her input first?
Well, can I just say thank you so much, Juliet? That was a very inspiring talk from a woman's perspective. I think, taking care of ourselves, loving ourselves, giving that time is so important, isn't it? Often in our busy lifestyle, like Dr. Madhu Shah was saying, that we, women tend to sort of not, put others before themselves.
Yes.
Which is, motherly instinct, basically.
Yes.
But we must learn to take that time to look after and love ourselves. I think that's so important. That message, I'm going to take away with me, because I do believe in it, but I need to find that time to practice. So thank you for inspiring me.
Absolute pleasure.
And you. Sam, our resident guest contributor, a regular contributor on Healing Our Earth, coming in from Scotland, from a yoga background. So tell us, Sam, what's your thought on this?
Yoga is to learn to love yourself. We love everybody else, we forget to love yourself. That's what the biggest issue is.
Absolutely. And I think Juliet has put that into practice quite well, because she says, don't beat yourself up. Do what you can. Yoga is not competitive. You're working for yourself. So really, it's yourself that you're looking after. And that's something that I must say, I've been working with Juliet on and off for the last probably about 17, 18 years. And the on and off was only because she decided to become a mother 3 times and that she had to take time off. But otherwise, we've been blessed with a wonderful lady chiropractor who works in our clinic. We work together and really throwing a very different angle to patient management, on not to beat yourself up, and to help yourself to get better. So Juliet, that was wonderful, outstanding. Thank you for joining us on Healing Over Earth. Your time was very much appreciated today.
Thank you. Namaste.
Hey, namaste to you too.
Juliet, stay around. I want to ask you a couple of questions.
Okay.
And Lalit, I want to ask you a question as well. So Lalit, you are a chiropractor.
Yes.
A senior one at that, as is Juliet. And both of you mentioned yoga. What is a correlation and how much integral it is yoga and chiropractic? Because some of the way you help patients either is to correctly stretch them or just reset the body, as does yoga. How important do you think chiropractic stems from yoga? Because yoga is very old. It's more than 5, 7, 8,000 years old. That is on a record. And Patanjali actually was more than 5,000 years back. What correlation do you put and how important it is, yoga and chiropractic? First to you, Lalit.
Okay, so in my opinion, first of all, I'm going to answer your question. Did chiropractic come from yoga? I don't think that was the case, but I'll tell you what the biggest correlation with chiropractic and yoga is. Chiropractic deals with the health status of your spine. Your spine is the structure that holds you upright. Now, if your skeleton is mishapped or not working very well, you're not going to be functioning very well. The structure determines the function. The structure is from your core, your skeleton, and that's going to determine your function. Now, if your structure doesn't work well, you're not going to function. And I repeat this because yoga actually helps maintain the structure of your body. So the flexibility of the spine, the stretchability of your muscles, the stretchability and flexibility of your joints, all that is where yoga comes in. How much flexible and how much stretchability do you have? Because that is what will determine your functional capacity of your body, of your spine, of your joints. So the suppler you are, the more flexible you are, the better the function. Yoga doesn't only make you supple. Yoga also strengthens your bone. Yoga also strengthens your muscles. So the strength that you get in your muscles and your bones also determines your spinal health. So that's how I connect yoga and chiropractic, that through the adjustments of the spine, we make the spine supple, but through yoga, we keep it supple. It's maintained in its flexibility. So that's my take on it.
And Lalit is a very good take. In fact, you've actually answered to me whether chiropractic comes from yoga or yoga comes from chiropractic. So yoga stemmed back more than, in a recorded history, more than 7,000 years back. Chiropractic is approximately 150 years old. And prior to chiropractic as a profession that came into the field of medicine in some form, long way back, as you said, yoga can also help you stabilize yourself and maybe help you. So I think there is some sort of a correlation that long way back, something helped us before the new things that came into the market, which are only 100, 200, 300, 400 years old now, because previously there was nothing there. Juliet, you are a woman.
Yes.
I want to ask a slightly complex question to you.
Okay, go on then.
Women, and this is where men really needs to educate themselves. If women has got everything on the earth, few million diamonds, the best cars, the best house and everything, they still sometimes feel they are not necessarily happy because the hormones plays a long and big part in a woman's life. You are a woman as well. Generally, you kept yourself well. You're always smiling. How important, and you do yoga. So
Yay.
how do you calm yourself with yoga? And because you got chiropractic knowledge, how do you entwine both of them together, or do you do that?
I found yoga later in life after chiropractic. So for me, the chiropractic came first. I think chiropractic is more of a therapy, if I'm allowed to use that word. So it can, people who are in quite vulnerable states, desperate states, they can really have a transformation with only one treatment sometimes. Sometimes they need a long series of care, of course. And I think that is slightly the difference. And yoga, I think, has been around for a lot longer, and I totally respect that. But I think both, there are similarities in that they're both based on the spine. And it'll be the nervous system that yoga stems from. So I use yoga, I think, more, to help keep up my flexibility, for example, and to work, more on my general whole system, and to keep up my fitness as well. But chiropractic can be a very powerful tool as well. So that's the way I combine the two. I think you asked me about things from a woman perspective. I think regarding calmness, I'm always working on that one. I think naturally I am quite calm generally, but that doesn't mean that I'm never anxious or anything, or I don't experience. I'm also very emotional, and I love experiencing all my emotions. But I come back to my calm. I recommend yoga because you can really get in touch with different things you're going through and release them. So that's great. And sometimes it might be chiropractic that helps me do that as well. So I think it helps that woman in her journey in her life, wherever she's at, whether she's young or whether she's old, or so
wonderful inputs from both senior chiropractors who both practices yoga. Of course, if you got any medical condition, or if you got any serious condition with your spine or something, don't jump into yoga first. Go and see your chiropractor. And chances are, a lot of chiropractors now practices yoga. Then take advice from them so that you will get a proper advice. So don't just jump into yoga willy-nilly, depending on your condition. But both of them do like yoga as well. Now, before we go to Shelly Ali, who is actually going to talk about how faith and health care works together. And Lalit, before we bring Shelly in a moment, let's go to our yoga practitioner who has been practicing for several years and is one of the lead gurus. Sam, if you've got a spine problem and or back problem or something, do you believe in chiropractors? Do you go to chiropractor? You are a yoga expert. What are your thoughts on that?
I'll tell you my scenario. In 1990, I used to play a lot of golf. So I had a very severe slip disc. My father was a doctor. She used to give me sometimes steroid tablet and sometimes constant. That's where that time they had a constant tablet. I used to take 4 or 5 tablets daily for releasing the pain. But since I joined yoga, doing Markat asana, doing certain asana, which I've learned, every time I have pain, I do that, my pain goes away. So I had never need to go to Sodha or Anderson. So I have no pain at all now. And also when I'm showering, I take cold shower, hot shower, cold shower, hot shower. So that expands the system and my nerve system. And also I use my electric pain as well to release my pain. What my Swamiji told me, you promote things people can do it themselves. Don't need a third-party intervention. And that's why I try to teach people through my own training when I take classes. Everybody has lower back pain these days because I'm dealing with people who are over 60, 50 years old. They had a severe posture problem, things like that over the years, kind of work they did. But same time, I do respect professional. People have told me, go to him, go to Cropper, they will do this for you. But I'm reluctant to go so far. I've managed to manage my symptom myself through my own yoga practice and acupressure.
Well, Sam, you found 2 friends here. If ever you need any chiropractic advice, they're directly connected to you.
They're too expensive. Can't afford
Well, they can work out a pro bono deal for both of you, so don't worry about that.
No, I'm kidding you all. Just kidding you.
Yeah, Sam loves his jokes and all those things. But look, it's nice that we are meeting each other. So what we are going to do, let's take a quick question from Kailash here, and Shelly, get ready. Lalit is going to introduce a moment from now. Kailash, your comment before you zoom
Yes,
off.
thank you, Neil Kumar. I just wanted to make a comment that we talked about health all afternoon, and one of the things I wanted to say is, health is also what we call our bhakti, our devotion, because in our scriptures it does talk about the 9 forms of bhakti, and one of is looking after our health. They talk about doing the asana, dhyan, all this. So again, from a spiritual point of view, it's very necessary. All this yoga, Ayurveda, they're all sciences. They are all sacred sciences, basically. So I just wanted to leave that thought with you. So thank you so much for inviting me, and thank you to all the speakers. It's been very inspiring, and I just want to take everything in and start putting that into practice. So thank you for inspiring me today. I do have another commitment this afternoon, so thank you, and look forward to seeing you all at the next session. Thank you.
Thank you, Kailash. And the episode carries on. Lata, you might get a chance bit later after Shelly Ali. So Lalit, we've got an alternative view here as well. Quite exciting. So let's get into it, and please introduce Shelly Ali, and over to you, Lalit Sodha.
Absolutely. A namaste, global namaste to you, Shelly Ali. Welcome on Healing Our Earth with our today's coverage of universal health.
Hi, everyone.
Welcome. Can you hear me?
I can, yes.
Okay, so a very warm welcome to you on this online platform, Shelly.
Can everyone hear me clearly?
I can hear you.
Great.
Yeah. Just wanted to warmly welcome you on this online platform. We are talking about universal health coverage today.
Thank you very much.
Yeah. So Shelly is actually a lawyer by profession and a member of the public who would love to share her opinion on health. And so let me ask you first, and then I've got a series of questions for you, Shelly. What do you particularly view health as?
Health in what sense? Generally, or just
general health? Yes.
I suppose it's something difficult to answer in one go, but I think health is both physical and mental. So it's psychological. It's not just about how you feel externally, but how you feel internally. And they both play an important role, obviously, with each other. It's interlinked, so I don't think it's possible for me to separate it. I'm not sure if it's possible for anyone to necessarily separate it, but those two aspects play a key part. And then the understanding behind health. So from a intellectual point of view, be that because you've studied medicine or some way have a better understanding of medicine, or from a cultural perspective. So there's lots of things about health which I think all interact with each other.
Perfect. Now, hitting it on from a cultural perspective, we had a little chat not so long ago, and you were talking about how people talk about health amongst each other. And they're telling, oh, I was suffering back pain, or I was suffering a headache. This is what I did. Maybe this is what you should do. So this, what we termed as nuska, a tip that everybody gives each other. What are your thoughts on it? And can you maybe share some of those thoughts, some of those nuskas, if I may say? Some people say, oh, I've got a headache, or I'm very tired. Oh, drink a chamomile tea. Oh, that will relax you, kind of thing. It's a kind of a tip that people are giving. Some of the tips that you have heard in different cultures. So if you would share something like that.
Yeah, I mean, I could definitely talk from my own cultural perspective. I come from the Bangladeshi community. And we are, I think, as unique as all the other communities. We all have our little nuances. As an example, I think the one of the issues with medicine or treatments is the lack of understanding behind it. So often people will rely on either old wives' tales, which have been passed down from generation to generation. And that's not to say that that's a good thing or a bad thing even. It's just that over the course of time, people have got a better understanding of what works and what doesn't work, with perhaps a scientific input as well. So there may be old wives' tales which may well have worked for generations and generations, but because food and diet has changed, those things no longer are as effective, in my opinion, as what they will have been maybe 60, 80, 100 years ago. Back when processed foods, for example, didn't exist, it didn't impact our diet as much and therefore didn't impact our health as much. So I think traditional remedies, which may have been quite effective actually back then, probably are just a bit more in a diluted form effective in the current climate, I would say, in the current sort of society today. My mother-in-law, for example, who Dr. Sodha knows very well, she likes to use lots of traditional remedies, including various sort of syrups and teas, from methi seeds to fenugreek from the actual fenugreek leaves to the seeds, to cardamom, to ginger, turmeric, you name it. She will give those concoctions a go. But equally, she relies on traditional medicine as well. Sort of meaning the sort of pharmaceutical medicines as well, and quick fixes, as I call them. So if, for example, before we came to see Dr. Sodha, it was very much going to the GP, trying to get pain relief, muscle relaxants, and so forth. And in all honesty, none of that actually worked, not as effectively as what worked when we went and met Dr. Sodha. And I'm always grateful to Dr. Sodha actually and his team for all the help that they've provided my mother-in-law and my mother actually, and a number of individuals that I've introduced. So thank you very much from the bottom of my heart for all of the input that you've had in that respect. But it opened up a whole new world for me as well. Something which I hadn't considered as an option myself. Again, I think it was lack of knowledge and awareness. So I actively encourage the sharing of the newsletters that you send, I think on a monthly basis, if I'm right. But I think traditional medicine, in terms of cultural perspective, was effective, probably still is effective for those who have used it from a very young age. But because we also use dispensed medication as well, I think perhaps it's not as effective as what it might well have been many a year ago. So yeah, I mean, we definitely we'll try things, and mother-in-law will give new recipes a try and cook something up. And sometimes they work and sometimes they don't.
Sure. So I would love to, like, see, we're talking about health topics. Now, these are lovely health nuskas as we speak about them at home. So some of these little tips that are sort of ethnically very different, traditionally very different in a household, what are some of those tips that you would share with the audience? Something that you would do, say, for a cough cold remedy rather than taking an antibiotic or Lemsip. What would you take as a little health tip?
So a very common one in our culture is actually black seed oil.
Black seed oil.
Yeah, and it's you can get it in its organic format as well, which we prefer. Cold pressed black seed oil is a very, very popular one in our community. That is, I would say, number one.
And you would just drink it? Is that what you do?
Just a spoonful, straight down.
Really?
Yeah. It's believed to have many other known benefits, just for aches and ailments as well. I think it's similar to the Mediterranean culture, where I believe, and I'm happy to be corrected, but someone who from that background might be able to assist, but olive oil as well is believed, a spoon of olive oil. I think some people, just 1 teaspoon of, I don't know, an extra virgin, which I imagine is a better form to have. That might be something which I don't know if anyone else on the screen is familiar with that tip. And then second,
we got to mention that the sesame or black seed oil is the same as onion seed oil. Is that correct? Meeta Joshi, I think you mentioned that comment to us, eh? So would you agree with that, Shelley?
Black seed. Do you know? I don't actually know. I think it's similar to is it the Nigella seed? I think it's similar to the Nigella seed, if I'm correct. I can happily look into that and feedback on a different
Sure.
occasion, perhaps.
Sure.
But
that's interesting. That's like a little tip that is not traditionally used by modern medicine, but it's something that has been used as a little, I wouldn't say it's an old wives' tale, but it's something that's been utilized in a different culture for common cold. In terms of, a lot of people have this little tip for a toothache. What's something that you've used for a toothache?
The black clove.
Black clove. Yeah, black clove or clove oil that they would put in a
Just pop
cotton
it
wool
to the
and patch
side.
it on. Yeah.
And then just to suck on it, or preferably not to chew on it, but to just let it sit there and allow it to do its magic. And it apparently does work quite well, I'm told. I haven't personally tried it, I must confess. But I'm told from people who have tried it that it works reliably well. The other one I think is a common one, which I think even Beechams have taken over, which is honey and lemon with a bit of ginger. So I think I have found that in recent years, and I don't know if this is anyone else's experience, but what we would describe as traditional medicine, such as ginger, turmeric, even garlic, actually, these have all now found its way to shop shelves. So something that we've used for, probably hundreds of years, very easily found, locally sourced produce, effectively, have found its way to very well-known shops, which I'm sure we're all aware of. And yeah, I mean, in capsule forms, there's turmeric and ginger, and various other root veg and things like that people are using.
Sure.
So maybe there is a lot of truth in it, not just from a traditional point of view, but from an actual scientific point of view as well now.
Well, it's
Backed by science, as they say.
What used to be the old wives' tale, having turmeric with hot milk and to help your cough and cold, which used to be many years ago, so to say, a home remedy, now has come up into the popular coffee shops as turmeric latte.
Yes. Yeah, I mean, for those kind of things, I mean, the other traditional Bengali recipe, I say traditional, I don't know if it's just Bengalis or other communities, but it's actually just straight crushed ginger juice. So just a thumb-sized piece of ginger, crushed skin on, and you extract the juice, and as a tablespoon, have it as a shot down. Tastes awful, I might add, but
and how would that help?
It's meant to be sort of a natural sort of antiseptic healing remedy, which is also meant to sting the throat a little bit and clear any infections. That's what it's believed to help with. I haven't actually looked at the science behind it, but I have tried that one myself with a bit of lemon and tiny bit of honey. And it's quite soothing, actually. It's actually quite soothing. Tastes awful, but very soothing.
Okay, from a general member of public, I would like to ask you a question that there are certain healthcare facilities that are available under the National Health. There are alternative care or complementary care like chiropractic, Ayurveda, homeopathy that are prescribing these wild and wonderful drugs for our health and helping us. How much do you believe that this should also be or subsidized or be under the National Health Service?
I think prior to coming across chiropractic services, I probably wouldn't have had such a strong view. Now that I've physically seen for myself the benefits of it, I think that's helped inform my opinion, and I think it would be incredibly helpful to have it under NHS services. I think we would save ourselves a lot of money through physiotherapy and other treatments that are readily available on the NHS, and our short-term solutions to people's long-term problems. I think it would hugely benefit, but I don't think the government's going to be quite ready to take that leap just yet. But I do think it's something which should be on the table. I think it would benefit the aging generations, and in particular, that's not to say it can't help other people, because as you know, Dr. Sodha, I bring my mum to your clinic. I had zero awareness that migraines could be assisted. And again, it was just because of a lack of knowledge. I think if there was more publicity about the kind of things that this form of treatment could benefit other people with, it would help. I think it would hugely help. Obviously, the aging generations, they are on a lower income, so affordability will be a factor, and we can't be shy about that. So those kind of things and number crunching will no doubt play a factor in things as well, and what people take up as a alternative treatment. So yeah, I think knowledge, awareness, spreading that information, and making it financially viable for people, access it more readily. But I don't know if there's enough of you chiropractors out there. That's what you'll have to tell me.
Yeah. Obviously, there's a drive to bring it under, or at least partly subsidized with the National Health Service. So let's see what the future holds.
Yeah.
Obviously, it's a
Sounds
lot of
interesting.
work. Yeah.
Watch this
Lot of
space,
work.
as they say.
Watch the space. That's correct. Shelley, I really want to thank you from the bottom of our heart and on behalf of Healing Our Earth, coming on today with us, sharing your thoughts as a member of public, your views on health, your home nuskas, as we would call it. And I think it is so important that these things are utilized. And I think in terms of universal health, it just doesn't mean that you need to seek professional help or see a general practitioner or a specialist. There's so many things, like little home things that we can do to help ourselves, whether it is herbal remedy, whether it is exercises, whether it is having a Olbas oil, hot steam that helps your
Yeah.
nasal sinuses clear up. And I think those home things are so vital in health. And I think we should all be aware of these little tips. And thank you for sharing them. That's all
No,
I would
thank you
like
very
to
much for
say.
having me on board.
Yes, and I would like to, while we are here, we have Dr. Anjali Agarwal. She's a resident doctor. A warm welcome and a global namaste to you, Dr. Agarwal.
Global Namaste, Dr. Sodha, and everybody. Thank you so much, Shelly ma'am. It was a lovely, information shared by you. Thank you so
Yeah.
much.
Thank you.
And what are your thoughts, Dr. Agarwal, on this particular ginger crushing and having it just neat and it's a strong taste? What do you think about that?
Well, it's a fabulous thing. I do it every day. I think
Oh,
that's
there
the
you
best
go.
way to, fight all the bugs and the viruses and the bacteria. And the
Wonderful.
Nigella seeds
Very well
is
endorsed by our
thumbs up.
resident doctor. So thank you very much. Shelley, once again, on behalf of
Thank you.
Healing Our Earth, a thank you to you for coming on this Sunday afternoon. I know you had a very busy schedule, but you made some time for us. So from all of us, a very warm thank you.
Thank you very much, everyone. Have a good afternoon.
Thank you. And Dr. Agarwal, welcome, welcome, welcome to Healing Our Earth once again.
Thank you so much, Dr. Lalit. Thank you, everybody from the Healing and Earth family.
Yes, yes, truly excited. We've had a wonderful line of speakers from 2 o'clock onwards. We've had Professor Sharma from the Ayurvedic specialty. My God, amazing information shared by him. We had this amazing presentation by Dr. Professor Saglani. She made a worthwhile contribution on how to connect with the government to get some funding, to get health care, and to get some good universal coverage. What are your
Wow.
thoughts about all this, Dr. Agarwal?
I think we all deserve to get health for all. And as care providers like you, me, and everyone present here, our prime goal is also to prevent a disease from happening so that we don't need a cure. That's a fundamental goal for everybody as a care provider. So I think preventive promotive healthcare should be at the tip of our fingertips now. A good spine, as you would say, a good health by Shelly ma'am, like, fighting off all the bugs for cold and viruses, so that you don't go into a mode where you are into a phase where you need medications and you need to actually go and access healthcare in the hospital, which is delayed care sometimes. So prevent at first, then treat it later. That should be the concept always. Shouldn't be the concept. So prevent it and treat it there and then. I think the first line of approach is early treatment for anything, which could be your, kitchen, which could be Dr. Lalit helping you with your spine adjustments. There can be other thought processes, healthy thought processes, and yoga by, our resident Sam. So all of this is cultivating towards bringing about a healthy intervention for a very preventive care for our health. rather than just going and getting yourself treated all the time, which becomes delayed at times because of the government initiatives. But we do want health for all, and without any biases, without any judgments, and without any prejudices. Everybody should be able to access health, and it should be given with, due consideration for everyone. I think so, Dr. Lalit. What
I
are
agree
your...
with you. 100% agree with you. 100%
Yeah.
agree with you. And this is where the slight debate is going on in terms of what should be made available that is currently not available on in England. Like for us, we would say the National Health Service should cover a certain amount of complementary alternative care. How accessible should different healthcares like homeopathy, Ayurveda, yoga, chiropractic, osteopathy, physiotherapy should be available to the patients where they don't have to really, money is not a question, it's offered to them. So that's something that has been going on. So I'd like to hear your view on that too. I know, yes, it should be accessible, but how could we make it more sort of more a public knowledge, more a government knowledge, and that they can help us out? Any thoughts on that?
How about intervening into camps and all? You have your government and your care providers putting up a camp, a health camp, where you access every individual family members, and then they bring them together and talk about, suppose, back pain, or suppose you're talking about how to fight cold and flu or build immunity, or how do you want to take care of CPR, teach your family members how to emergency give them, cardiopulmonary resuscitation. So these are educations which I think if we do as care providers and governments together, the government will understand that if we start giving alternative care right in the beginning, the load on the government hospitals will come down, or for NHS would come down. So if I'm taking care of my back pain right at the initial start, I don't want to be waiting for my physiotherapist appointment 6 months down the lane to get treated for my back pain. So treat it early and just get it sorted in the initial days. Make the physio clinics wide. Employ more physiotherapists in the UK if it's for UK. In India, it's easily accessible. It's people can just go walk down to any clinic. So accessibility for physio appointments is not a challenge in India. But I think in UK, I always hear from patients is like it's 6 month waiting. They've been told that, okay, it's 1 year waiting, or chiropractic practice they want to approach. It's expensive for them sometimes. So I think a reasonable foundation can be laid where all accessible care, which can mitigate, prevent, long-term damages to the health, can be given by government coming together, care providers coming together. I think the intermingling of services together, that would play a very good role.
A very valid point. Yes, absolutely a very valid point. And I think, as you said, in India, it is readily available to get to a physiotherapist and it's not an issue. Here, there is a protocol that one has to follow from visiting a general practitioner and then to go to a physiotherapist, and the appointment times are quite long in between one to the next because purely due to lack of availability. So that's a challenge that we face over here. However, I totally and agree with you that detect the problem and treat it as soon as you can. Don't wait for it to get worse. Oftentimes, the 5 dangerous words that we all think about, maybe it will go away. And it doesn't go away. It lingers on. And that's where we go wrong. So yes, I think that one form of preventative health care, preventative health mindset should also be introduced with the general public, that don't ignore your pain. Pain is a symptom that's telling you something, that something's not quite right.
Right.
Yeah. Wonderful. I think that's a wonderful tip for all of us in talking about healthcare, talking about universal health, and also for the general public. And you know what? We have this wonderful gentleman with us from Scotland, Mr. Sam, who's preaching so much of preventative healthcare through yoga. So would love to hear from him. Dr. Agarwal would love to hear your questions with Sam also. and continue with our universal health coverage.
Thank you very much, Lalit.
A very warm welcome to also Lata from the healing team. Global Namaste, Dr. Amrita. Global Namaste to you too.
Global Namaste to all. And yeah.
Okay, we can hear you, Lata.
Sorry,
I had a couple of questions and remarks, comments to add.
Please do so.
Yeah, it's always lovely to have you there, Dr. Sodha.
Pleasure
with a
to be here.
beautiful, beaming smile. And I just wanted to mention how my experience has been with the chiropractor.
Sure.
It's been a wonderful and amazing sense of relief, you know, when we were told about it about 30 years ago, I think, 35 years ago.
Wow.
And it was such a wonderful experience because the pain just instantly cures and goes. You know, within 2-3 sessions, it's so much relief. You can get back to a basically normal life, but you got to keep up the sessions. Yes, it's expensive, but if you're under private, then it makes it easier to access. But then again, I feel there was the one thing for the rich and one thing for the poor. So I felt it should be more accessible within NHS. So then the awareness will automatically grow, because physiotherapy is now improved a lot in the accessibility in the UK. You can self-refer, which is amazing. You know, you don't have to go through that other process that was like 6 months down the line or whatever, 1 year or 9 months. But now you can self-refer, and you can, alongside yoga, because now I've discovered yoga. Yoga has been sort of the, suppleness and all that energy boosting and the emotional well-being and everything else. So it helps you to manage so many aspects, but alongside with chiropractic also, because chiropractic, I think yoga helps you to click your body in ways
Makes the body very supple, yes.
Yeah. So it's self chiropractic in a way, but yes, there's still a lot of room for improvement with the chiropractic to come into the NHS. That would be the thing that I would really flag up and
Thank you. Thank you for sharing your views, Lata. And thank you for sharing that chiropractic has been so helpful for you. And yes, you're very right. It does help you with instant pain relief. And then obviously you've got to maintain it, and maintaining it through yoga, as you say, is also a very, very nice way of doing that. But thank you. Thank you for sharing that view. Dr. Amrita, do you have any points that you would like to make on this particular section?
No, I think a lot has been said, and Dr. Anjali has been saying these things, and I resonate with her words on that. And specifically when it comes to the practice of yoga and keeping your musculoskeletal tissue healthy, that's one of the best thing, because from my point of view as a yoga physiologist, I recommend people, there are, I think, only few postures in which we live our life and we die. But then yoga gives much, much more than that, which we can't even imagine. And then there are only few muscles that we use out of so many that God has gifted us. And yoga makes us go and move. And they also say, yes, we exist in life and we have to make things happy. And especially the iliopsoas. I love that muscle well, because that's one of the keys of everything. So the source stories are pretty happening, and it's very nice to involve every muscle and engage it. And then it's nice to hear. And let's Dr. Lalit go to Scotland and welcome our yoga expert, Sam. Global namaste to you, Sam.
Namaste. Namaste. Thank you very much, all of you. Really, I've been enjoying so far. I've learned a lot as well. The day I die, I'll be learning every day something new.
Absolutely. You never stop learning. Isn't that true, Sam?
We have forgotten how intelligent our body is. We have more power than we lead to believe. Mind over matter. Through Patanjali, I've learned to heal myself through yoga, which is pranayama and asana. Ayurveda, think of food as medicine. Every food has a medicine value, mind over matter again. No point eating avocado, but you don't know why you're eating it. You have to eating to lower the cholesterol or to control your diabetes because of chromium. Whatever mind thinks, body delivers. Next is acupressure. And that's where I kind of take some of the business of Lalit ji as well. By acupressure, I can heal a lot of body with pain as well. They can release the pain through the acupressure because it's all about nervous system. Any blockage, हम लोग बोलते ना है पूरा दुनिया का बोझ कंधे में उठाए हुए हैं. That's why people have frozen shoulder and things like that. Once the energy flows, prana flows down, everything opens up, and the pain goes away. And that's why you're doing as well through acupressure, through the thing you're trying to release the energy from the blockage, or it makes you it's not happening. And then obviously naturopathy, where the body is made up of 5 elements: fire, air, space, earth, and water. Use those elements to heal the body. Fire is positive, air is positive, space is negative, earth is neutral, water is negative. It's like a modern science where they say molecules are made of proton and electron. Old science was everything was made of fire, air, space, earth, and water. It's just the same thing saying in different way. Right? And then obviously balanced living, how to reduce your stress. And that's all about prana. So today I'm talking about more about immune system. Winter is upon us. A lot of people become ill. I don't want to become ill this winter. I won't. For the last 20 years, what I've done, I've never become ill. I never had a flu. Before I used to flu all the time. I can only tell you what I have practiced on myself and benefited from it.
And I think it's vital when one is sharing their personal experience, because I think that's live talk.
That's my success comes from. My success came from because I always talk about what I've experienced, not what I read in the books and anywhere else.
Correct. Books has got lovely information, but I think personal experiences say 1,000 words more.
Thank you. Yes, excellent.
Yeah.
So,
but on that note, Sam, I'm just going to pause for a little bit. I'm not trying to stop you, but just wanted to say a global namaste to all of you. I will let Amrita take over because I've had to head for another commitment that I have, but it's been an outstanding pleasure talking to all of you today, learning so much about health and universal health and making some wonderful connections. So from myself, a global namaste to all of you. Sam, I'll let you continue with your presentation.
Thank you very much.
Thank you, Amrita.
Thank you, Dr. Lalit. Thank you so
Global
much for joining as well as for sharing your views. Thank you.
Thank you. And thank you, Dr. Agarwal.
Thank you.
Bye-bye. Bye-bye.
Yes, Sam, please continue.
Okay. So what I'm saying, first of all, it's all about prana. The body to be alive, you need a prana. When the baby is born, it borns with a fist. What does the fist does? Opens up the airways. And that's when the breath, through breath, prana enters the body and baby starts crying. So prana is all about prana. And that's what gives, and next is spirituality. Because body needs a fuel. Your spirituality gives you the fuel to energize and promote good health. And then you have to stay hydrated. What is hydration? Just drinking a lot of water, you won't get hydrated. To get hydrated, you have to have electrolytes. Water need to go into your cells. If it doesn't go in the cell, then you have then you become dehydrated. And the job of electrolytes are sodium, potassium, and magnesium. Sodium takes the water and puts them into the cell. If they don't go, that's when you have headache, tiredness, fatigue, all these things happen. Next, winter time to increase the immune system is the nitric oxide, which is the best for overall health. It's actually a gas which is stored in the lining of our blood vessel that helps to dilate the blood vessel and reduce blood pressure. It's a free radical. Nitric oxide actually kills cancer cells as well. They use it in hospital for mouth cancer. And nitric oxide also used for CPOD, for lung infection. And also, so it's very important to create nitric oxide. Every time you go out, when you had COVID-19, that's what I used to do. When I come back in, I used to do humming sound and produce nitric oxide in nasal passages, and that killed the virus if you catch any virus. Even just now with the flu and anything else as well. Even sounding Om releases nitric oxide as well. And then you have intermittent fasting. Inside body, you have a lot of soldiers like liver, spleen, lymph node, kidney, and so on. They help to digest, throw out toxin, and remove dead cell from the body and fight the virus to keep your body healthy. The three main jobs are digestive, throwing out toxins, and dead cell and healing. Remember, highly clean body is highly immune body. So the more you clean your body up, less chance of you becoming ill. Even Japanese scientists have won a Nobel Prize for work on fasting. Fasting helps to remove dead cells from your body. Body will get more time to throw out the toxin and dead cell by intermittent fasting. So after 6, 7 o'clock, you don't eat until next morning, 10, 11 o'clock. So that gives you time after digestive power, does the healing process and so on. Last on the list, the main focus mind will be lymphatic system. There are two kinds of fluid in the body, blood and the lymph fluid. Blood has a heart which pumps up blood all throughout the body to provide oxygen and nutrients, but lymph fluid doesn't have a pump. They use the muscle located, they're contained in lymph nodes. There are 600 lymph nodes in the body, located in 5 locations: your calf muscle, your groin, your stomach, under the armpit and throat, and the ear. And for calf muscle, the best way is you have to do certain exercise to make the pump. You're using a muscle to pump the lymph fluid, can travel and fight infection and promote good health. It's very important. So really, there's certain exercise you have to do that, and also, and also the stress. Stress is one of the biggest causes as well. How do you do stress? One is a thymus gland, just between the breast. If you press it, tap it, and you breathe in and breathe out through your mouth, you increase your. इससे आपका anxiety कम होता है, and you increase you activate your T cells, which are able to fight more infection just by doing this. क्या होता है, इसीलिए इंडिया में भी बात कोई मरता है, when you stress, you bang your chest, इससे आपका anxiety कम हो जाता है. When you feel anxious, based by tapping it, you prevent that as well. So really, and for the lymph, how do you fight? How do you improve your lymph fluid? By certain exercise. How do you exercise? So how do you exercise your calf muscle? By walking 10,000 steps every day. Give yourself a target. Walking is use your calf muscle as a pump to pump up the lymph fluid to fight infection. And for groin, you do the butterfly. Butterfly, doing it itself 40 to 50 times daily will pump up the lymph fluid from groin all the way up. And for stomach, you put your hand up like this and do Kapalbhati for whatever, depending on where you are. And under the armpit, you put your arm like that, tap it there, both sides, right and left, and then lifting up and down. And then also the lymph fluid is 3 points above the finger. You press it and use your finger as a pump. That pumps up the lymph fluid from left side and removes any toxins, and also prevents any lump forming in the body, prevention of cancer and so on as well. Plays a very important part. And then ear, remember हम जो school में थे, when in India, back home, when you're punishment, they used to make you hold your ear like this and you sit down up and down 100 times. Just by doing this, you increase your immune system because ear nerves, lymph nodes are in the ear as well. That's when the children tend to get kapha dosa, where they get the sore throat, tonsil, and so ear infection and so on. Just by doing this. Also, crossing your hand, you increase your memory power as well. It was a punishment, but it was for the benefit, not just a punishment. The lymph node plays a very important part in promoting health. And I can go more, but any question, anybody wants to ask any question on that, anything at all so far? And I really, prana is very important. I'm happy to hear to Keith here as well. Keith Sharp, he'll be saying something afterward as well, but all about, what he represents.
Yeah. Thank you, Sam. So I also wanted to know about what do you think is the role of how can people combat their anxiety and stress through pranayama and yoga?
Best way, breath is the main way to get rid of anxiety. So what
Hmm.
you do, you need more prana. So all you do, you scoop prana from your body, hand, you come up, you breathe in gently, and when you turn your hand round, breathe out twice the length of breathing in. That will slowly you breathe in through your mouth, and that will calm you down completely. And also pressing your thymus gland. Tap it, or you can press it and do Kapalbhati.
What is a thymus gland? Can you tell our
Thymus gland,
viewers, for all those who don't know?
thymus gland is between throat and there. There's a gland which activates, which reduces stress, anxiety, and also activates the T cell, which is able to fight infection. Is between the chest point, just below the thyroid gland, under the chest point. Obviously, I'm a structural engineer. I'm a plumber. I'm not a doctor. So but that's why I done the research, and that's why just by tapping here, really, that's why if I was a monkey, you give me banana, but don't give me it. I would say I want that banana. You tap it automatically. This automatically reaction body has, and that's what anxiety reduces anxiety as well.
Right. So that means the thymus gland is pretty much related with the immune system staying near the heart. It has a lot to do with the circulation as well as the pranic flow of life, right? And so what do you basically recommend people when people are suffering from chronic backache or stress-related backache? In that case, what do you think is good for people to practice?
The two things. One is through the Ayurveda, there's certain yoga practice where you like a marker. All the actions are copied of a different animal. Like a monkey, the way a monkey twists his back. When you lie in when you like a marker asana and you bend your knee and head your opposite, you're twisting your spine and you stretch the spine. That releases the pressure of the nerve system and your pain goes away. And also sitting or lying in the stomach, put your chin on the support and bend your knee back and forward. And swimming is one of the best exercises for back pain as well, for lower back pain. And also I use the acupressure pain as well, which if I do the setting, if I put the hand there, all my hand will shake. And that releases the back pain as well. I have back pain all the time, but that's why I heal myself. I know it works for me, and that's what I tell people when I teach along the
So why
classes.
do you press this point basically?
Again, it's all the nervous system. It's a blockage in the system. Every organ comes to the hand. Your spine is connected there.
I see. And then basically, so what is there specifically in this part of the hand which you were pressing? Can you show our viewers what instrument have you used and how they
No,
can like practice this thing?
this is like it contains just a wee battery. It sends electric current also. It's just like a medical equipment, but you can buy them in pharmacy as well. They use that for releasing the pain. Also, the first point is it tells the brain is in attack. So brain sends endorphin that releases the pain. That's the first point. Second is also by pressing the certain organ like a thyroid gland, your heart and lung, you energize those organs to more blood supply goes to there and promote good health as well. And but what I'm doing here is it's like if I have tennis elbow, if I put it there, my tennis elbow will go away. You see all the muscles shaking here. And then here, if I'm doing there, all my hands are shaking like that. I know it's not when I do the live session,
That's
that's when
interesting.
and then I can do the same with the feet as well. And if you're spondylitis, you put it there, all your neck muscle, you're not all I'm doing is opening up all the energy channel. Any blockage goes away. The energy can flow freely. That's what prana is. Prana needs to flow freely. If it doesn't flow freely, then you have a blockage. And also, usually I do if you put your hand clap it 9 times like this, there. So you're opening up all the energy channel. And this is your lung meridian point L1. You tap it there. What happened was when I went to the cruise, I met one of the doctors for acupuncture. He was an Indian professional acupuncturist. So I went to his class to learn from him what he does. He put the needle to the same point where their meridians are on the surface. And so we discussed each other and I learned something from him. And that's what I picked a few more points how to help people with healing their problem.
I see. That's very interesting, in fact. So, pressing certain points in the body, which you say you are tapping, and then the acupuncturist was working, the meridian points get triggered, which help to remove the toxins, I think, and that helps
We-
to
In Bolt,
detoxify.
in Bolton, I went to the cancer hospital. There was 40 patients with
Mm.
cancer. Doctor was sitting
Mhm.
there. They invited me to do a lecture on yoga, what to do to help them to manage the symptom better, or also depression and mental health and so on. Then by pressing the hand, I could tell what cancer they had. So
I
really,
see.
and I don't do it. I teach people how to find what's going wrong in your endocrine system. Every organ comes to you. By pressing the hand, you can tell which organ is struggling. Then you have to do something about it. If you don't do it, then cancer, everything doesn't come overnight. It takes time to develop. Cancer is not
Yeah.
from outside. It's cancer cells are dying, new cells are being born, and the imbalance of
Hmm.
cells in the body. So the immune system
Hmm.
needs to remove that dead cell. If it doesn't,
True.
that's what the cancer is. In my lifetime, I will have 6 to 10 times cancer cells. But because my immunity is high, it's removing the dead cells, so I have a balance in the body. So chance of me getting
Yeah.
cancer is nil.
Yeah. Yeah. That's very, very interesting, in fact, and how we can work on immunity. So basically, today's episode is where it's on the diversity of health and understanding health from different facets. And what you have touched is about how to build in an immunity and how to work on your own self and how your body's machinery is designed that it will give you a potential to have its own inner natural defense
Healing process.
system triggered up, which helps you to fight against diseases. Not only just on one basis, but just holistically without any medications, and you can find yourself with little bit of stuff. Let's hear from Dr. Anjali, and then we take up the comments from our regular contributor as well as resident Ayurveda experts, Rajan Patankaji.
One
Anjali,
thing,
yes,
can I
please.
add one
Yes,
thing?
yes.
I do a self-development course for 2 days, Saturday and
Huh.
Sunday. It's free. My times are free. Anybody wants to organize something, I can come and take classes where I use the
That's lovely.
yoga, Ayurveda, acupressure, naturopathy, and balanced living. Those 5 lecture on all those 5 things, how to heal their own body through natural,
Hmm.
no medicine, just from
Hmm.
certain practice of healing themselves. Thank you.
Okay, that's nice. That's good. Rajan sir, can you please make the camera landscape before we take your comments? Over to you, Anjali. Your comments on what Sam has been talking about and how the meridian techniques are helpful. Over to you.
Yeah, Sam, it's been a pleasure to listen to you, and it's really very helpful to be able to tap into your lymphatic, lymph nodes, because that's where your infection is stored. If you look at lymphadenopathy, which is like swelling of swollen lymph nodes, they are there for a reason. They are there, your first defense mechanism to protect your body from getting any bugs or viruses. So if your lymph gland swelling is there, it is an indication that there's a virus or a bug or an infection coming in. But if you tap into your system from the beginning, as Sam has described, you are kind of getting a very functional lymphatic drainage. That's how you detox your body. That's how you kind of drain all the toxins which are building up day to day in your life. So if you do this as a ritual every day or maybe weekly twice also, it's actually keeping your body in a much optimal level. And I think, thank you, Sam. It's been a pleasure listening to you. Thank you so much.
You can add other things onto to improve your healthy body. 2 things are very important: good digestive system and good excretory system. If your bowel movement is good and you digest the food, so all my yoga class, I focus on those 2 things on daily basis for every class, because that's if you have that, automatically your immune system increases.
That's perfect. That's a very perfect end, Sam. Uh, stay around, please. Let's talk further with Rajan Patankaji. Global namaste to you and a very good
Global,
morning
global
from
namaste,
US.
global namaste. Sorry, I joined late, but
No issues. Rajan Patankaji, you are an Ayurveda expert, and what Sam has talked is about the
yes, yes,
healthy
yes,
gut. and the healthy
correct.
diet and the healthy excretion. Now, how do you correlate these things with the Agni, and how does that work for a healthy body? Over to you. Please tell
That
us.
is most important. The excretion, as per Ayurveda, is the utmost important thing to increase your metabolism of the body. That is utmost important. And after you wake up in the early morning, if you excrete at that time, that is more beneficial. Because nowadays, people are working overnight or late night, and the excretion is not proper at that time. So they have to take so many medication and everything. But by doing some yoga and exercises, it will definitely help. But nowadays, two things are there. While doing yoga or exercise, all the machinery or all the gyms are air conditioned. That is utmost wrong thing. And in between, they used to give water. That is another bad thing. So the importance of exercise or yoga is not there while doing exercise in these conditions. So you have to exercise in open condition, and if you exercise hardly 5 to 10 minutes, it's more than enough as per my experience. Because I am doing not yoga, but plain exercises, stretching exercises for 5 minutes early in the morning. And that is beneficial for me. Second thing, as Sam told, that utmost important for the daily and seasonal regime, as per Ayurveda, swasthasya swastha rakshanam. Without any medication, you can do that. But it should be followed by each and every one, and should be followed or should be advised as per the climatic conditions of the different countries. Because Ayurveda is not generalized, but it is specifically personalized. So you must follow the tips or the advice given by the Vaidyas. That's my point. Thank you.
Perfect. That's very important. And that's why the importance of realizing how seasons and the foods are important, how seasonal vegetables are important, how the consumption of all that on time is also very important, and the circadian rhythm, which is related with the digestion and the mind gut axis, is also an important thing, which synchronizes with all the thoughts, and that's what makes us know how important is the role of my lifestyle personally, which we are working on towards how lifestyle can be a best medicine for an individual, for in terms of health, and realizing the importance of um, the workout, the diet, and all that stuff. So, Vaidya Rajanji, before you move over, because Ayurveda has emphasized a lot on sleep, what are your recommendations for people for sleeping? Because sleep is also related to health, and people don't know how sleep is related to health. So, what have you to say in regards of that? Thank
Yes,
you.
as per Ayurveda, sleep should be taken right from childhood up to the older ages, and it make definitely difference in that. Because if child sleeps 8 to 10 hours, it's more beneficial for him. But not the young people. That is not beneficial. Because what they are doing, they are either working late night. So that's why the sleep is not complete. And in the night, when the sun sets, you must sleep until early morning, up till sunrise. And in between those hours, you have to sleep at least 6 to 8 hours. That is more beneficial, but not in the early morning or after 12 or after like that. If you take your food at proper time in between 7 to 8, that is more beneficial, because automatically your mind and body get relaxed after 3 to 4 hours, means approximately at 10:30. And from there, if you wake up early in the morning, 6:30 or 7:30, that is more beneficial for your gut also.
Yeah. So 6:30 and 7:30 you say is important for your gut. Listening to the season and the timing in every country zone, the ideal time for waking up in the morning is a pretty early morning, and that helps up. I think that really helps up for an individual to work on that. Thank you so much, and it's time for us to tell you what we are sharing with you in coming future. So our future online episodes, which we will be broadcasting the very next week and the next Sunday on 15th of December 2024, is again a special episode of Glow Women, which is Global Women's Self-Care, specially dedicated on menopausal care. So 2 p.m. Greenish Mean Time onwards, you can watch, share, and also give in your inputs. And then we move with the Christmas bells ringing around, having fun, festivity, and singing on 22nd of December 2024 from 2 p.m. Greenwich Mean Time onwards. And therefore, we invite everyone to come join us to make these episodes as well, the future coming episodes, a success. So here we have again, as we talk about the different aspects of health in terms of yoga, we talked about different aspects of health in terms of lifestyle. We had been discussing about how just a simple tapping, as Sam, you mentioned, on the body, which people might not be even aware about. They think a machine, it's like the body is like a machine where you just have to have cosmetics, but it's lot more than that, and talks about the meridians that go here and there and talk to you in many ways, which is an essential part of it. Before we move further to our other guests, Sam, I would like to know more about what are your basic tips for an individual who's working in the office and regularly in the work life of sitting jobs? What kind of workout are beneficial for them, and how quickly they can manage that to balance their health? And specifically in terms of all that, because many people are pre-diabetic and they come into the range of diabetes for no reason, and they wonder why it happened and how it happened. But what are your tips on that, that how people can stay healthy with that work life? Over to you. Thank you.
See, sitting in the office is because your calf muscle are sitting idle. You're not moving around, and plus your posture is not right either. Usually, you're literally the computers. You're bending forward, so you're affecting your carotid vein, which supplies the blood vessel to that affects the whole neurosystem, nerve system in your body as well. And then your feet is sitting dead. If you don't use it, you lose it. That's when you stand up, your feet feel cramped and you feel kind of painful for movement. So really, you have to make your feet heel toe exercise whenever you can, sitting down in the office. If you do that, then the blood will pump up, reduce your blood pressure, also pump up the lymph fluid to fight infection as well. So that will help as well. And also posture plays a very big part. And obviously, I will recommend you to get up at least half an hour before you have to go to work, to the travel and all that, and then do some yoga practice, breathing exercise. More breathing exercise you do, more calmer you are, and also you increase your amount of oxygen in your oxygen saturation in your blood increases. That all helps to promote good health as well. The
So
yoga
Sam,
will play.
when you say when you say about breathing exercise, what particular breathing exercise do you recommend?
Yeah, before in my teaching now, I've learned now, before I do pranayama exercise, I tell them you might have a prana, but if you have a blockage, so first I do cleaning your blockage first. So like doing all the capping I did there, also do the hand exercise because all the fingers are, that's where the arthritis and all that, and do all the, all the different movement which you don't use on daily basis. Do those exercises to make the energy channels opening up. Also your feet, you do the feet exercise for cramp, for the gout, uric acid, and also for knee pain, you do certain exercise to make sure all the channels are open. It only takes about 10 minutes. It's not like sounds like a long, but it's not a long process. And then you just pump up, lift up, breathe in and breathe out, do 20 times. So, and then sitting in Gyan Mudra, and Khichdi Mudra, and you do for 1 minute deep breathing only. That the whole thing will take 10 to 50 minutes. That's all. That itself will give you enough energy to take the rest of the day kind of in between. Especially when you're sitting in the office. Most people go from house to car to office, and there's not enough sunshine. That's why you get lack of vitamin D3. I came from Indian subcontinent, and obviously we are North Hemisphere, lack of sunshine, and that's why we have lack of vitamin D3, which gives you depression and everything else. The immune system goes down. So I take 4,000 units of D3 daily and 100 microgram of K2. That makes my bone stronger as well. See, and reduce my cholesterol, because cholesterol gets transferred into vitamin D3 in the process kind of idea. So it's all, everything I'm telling you, I'm doing it myself. On my that's it.
Yeah,
Thank you.
that's very nice, in fact. And on that note, to know about how these things of pranayama and the mudras, they work together with the work in and help you in balancing up just by working on small tips that Sam has told. I think they are really wonderful and will be helpful for the people to integrate and use them for their personal life.
One thing, my expert is acupressure, mudra, and pranayama. And acupressure, I can teach people. That's what I do, to do it to themselves, and then find what's going wrong with the endocrine system. Then they can do something about it to make sure they don't become ill. जैसे यहाँ दबाते हैं, दर्द हो रहा है, तो tomorrow morning you'll have sore throat. तो पहले से हल्दी या नमक का गागल कर लोगे तो sore throat नहीं होगा. कहने का मतलब it's pretty jumping the gun and trying to. It's like cancer. If earlier you diagnose cancer, quicker easier to heal as well. It's the same kind of process. So that's why acupressure is a way of finding what's going wrong with your body. A lot of people don't know anything about what's happening to the body. They just go with the life until just think it won't happen to me. When it happens, then they say, oh God. So prevention is better than cure. That's what I'm trying to do. Prevent.
Yeah. Yeah. That's really good. Thank you so much, Sam. Please stay around. It's time for us to move to the next section of this episode, and let's move to Keith Sharp, our Tai Chi and Qigong lead. Global namaste to you, Sam, as well as let's welcome our guest contributor, Frank. A global namaste to you, Frank, and a very good afternoon to both of you as well. So, Keith, you are yourself an example at this age with being an engineer and in this field, relying and working and making people healthy through Qigong and Tai Chi. Now, what are the treasures hidden in this for making people healthy? First, let's hear from you before we move to Frank. Over to you. Thank you.
Well, good afternoon and global namaste to everybody. And thank you very much for everybody coming into this wonderful session. I'm going to change the emphasis a little bit this afternoon, but before I do, I'd like to thank Frank, because Frank has suffered over the last few days with the 93-mile-per-hour winds, and it wasn't, it was a very worrying time, I think, because we've had 70 miles an hour, and I think that adding 20 miles, thank you, Frank, for surviving, all right? I'm going to slightly change, if I may, to the organizers, in as much as that Frank and I are going to have a chat, and we're going to bring some perspectives in, not about the benefits necessarily of Tai Chi and Qi Kung, which I think we can put alongside yoga, Ayurveda, and prana, and everything else. But I've got 3 or 4 subjects here which I'd like to identify first. One is our experience, i.e. that of Frank and I, dealing with the NHS. The second one is, how do we feel about Tai Chi and Qi Kung for health and well-being being a profession? Thirdly, our thoughts on the Chartered Institute for the Management for Sports and Physical Activity and professional standards. Finally, maybe not finally, if we had anything else to add, is views on collaboration between traditional Chinese and Indian health in the Western world. So I'm going to open a question
if I may, to Frank, because I'm throwing the ball from one end of the cricket field to the other and hoping he catches it. What is your feelings, Frank, with regard to dealing with your local NHS or further afield?
Thank you, Keith, and global namaste to everybody. It is an interesting subject. I come from this from two perspectives, particularly as my Qigong and Tai Chi side of things, but also because I work alongside the NHS in my full-time job where I work for a charity. And in both cases, it has been really difficult without finding the right people and getting what I call a key to the door to allow me to come in. This has made a big difference, finding the right people to speak to. But there's so many things that are, shall I say, I don't want to say in the way, but you seem to go around the houses a lot before you get to the destination that you want to go to. It's, understandably in some circumstances that's not an issue, but I think there is more that could be done if you could just ask the right people in the first place, and there would be someone that would say, that seems like a really good idea, let's do it, rather than, okay, well, we now need to go to committee and we need to speak to this person, speak to that person. I have lots of NHS workers that come to my classes and they love it and they would love me to go in and do things for them.
I think that's very valuable information. And the problem that I think we've had for many, many years is finding funding trials. We both have worked for the NHS in various ways or through social services. But what can we do in terms of finding a funding stream which is really beneficial, not just for a couple of weeks, but also for a longer term period?
That is the difficult question. Funding is difficult for everybody currently, but I think there is ways to do that. I struggle, working for a charity, I get to see that sort of thing firsthand. But for us, I think our only way is to head the way that we're about to discuss about going to professional circumstances to make that, if we can find through that, it gives us more leeway. I think as individuals, it's really difficult to try and get involved. And to speak to the right people and get anybody to take you seriously. People know that what we do is beneficial, but I get more people actually referred from private medical practices like chiropractic, from private physios, from other people I know in our sort of world, from massagers, Reiki healers, people of that sort. They refer people to me far more than I do from some of the others.
Fantastic. One of the points that came up in an earlier conversation this afternoon was dealing with the national government, I suppose, is one way of putting it. But we talk about funding, and I've been dealing with this now since 2016, and I made out a process chart some years ago. And one of the things that keeps coming up is the benefits of exercise, not just Tai Chi and Qigong, but Indian activities with regard to falls prevention. And that is a major subject. And anything that we do nowadays, prevention is better than cure, as Sam kindly reminded us of. And it's trying to get what we professionals look, and I'm not suggesting that none of us are not professional, but as people who have been in commercial work for many years, is what is the return on investment? Now, NHS England put together a request to an organisation to look at this several years ago, and they came up with an incredible return on investment for Tai Chi. But what worries me is that I was dealing with the local clinical commissioning group here in Southampton a few years ago on a falls prevention program. And during that meeting, it became clear that Southampton Clinical Commissioning Group were going to invest £372,000 in a falls prevention program. And as is my wont, I asked the question, why are you not using Portsmouth who have already got a falls prevention program and are only 30 minutes down the road. The immediate answer from the senior person was, "We are Southampton, we are not Portsmouth." Wow. Well, now we do no longer have clinical commissioning groups. We have integrated care boards, of which Southampton and Portsmouth are part of. So return on investment is incredibly important. But I think that we've both got local experience of dealing with the NHS, a little bit of funding streams, but nothing more. So let's go on to how do we feel about Tai Chi and Qigong for health and well-being being a profession?
Definitely, it's one of the keys to making these things work, because it means that you've got somewhere to go with it. At the moment, it's something wonderful for me, but I have to work full time, and then teach in the evenings, teach weekends, and on any other time that I can find space to do so. But with it being made that, it would allow more ways to do better training, receive help, further guidance to make things work for you better. Plus, also, more people would take you seriously, which is something that we do come across. Yeah.
And I think also is that we're looking at it from a longer term perspective now. But within recent years, obviously, we've had the benefit of social media, whereas before it was 3 weeks before you got a reply to anything.
Yeah.
And we now have the international situation with many, many organizations. And it is paramount, I think, that in the future, it's likely that maybe within this decade, we end up with some formal relationship between those of us that provide complementary therapies for the benefit of the general public, and saying, really, what are we investing in? Is it an individual investing in a visit to the chiropractor? Can they afford it? How does it get funded? But equally, we have all the others like Reiki and many, many other aspects. So I'm in favor of being a profession. Having trained in an engineering background, is that I would not be able to go into an engineering situation saying I do not have some form of experience or qualification.
Yes.
And I think with our complementary therapies, whether they're Indian, whether they're Egyptian, whether they're Peruvian or Colombian, is that at some stage Tai Chi and Qigong and the Indian activities will come together. So equally following on from that, not as a separate subject, but hopefully adding some fuel to it, is that we have an agreement, some of us, with the Chartered Institute for the Management for Sports and Physical Activities. This is a Royal Charter organisation, and since 2017, there has been a partnership between certain Tai Chi organisations, the British Council of Chinese Martial Arts, and SIMSPA. And on that basis, we have professional standards for Tai Chi for health and well-being, and Qigong for health and well-being. And it's a step forward in some of us, the eyes of some of us, that this is a natural step to become, by the end of this decade, hopefully, a profession that we've discussed, and also an opportunity to have the whole of health and well-being, Tai Chi and Qigong, recognised by everyone. What do you think of that?
I think this is very important for us to get, in as much as there's always a bit of a lull between when you go to someone like the NHS, they say, well, what qualifications have you got? And while we may well have done a lot of practice and done a lot of teaching, it's not something, Tai Chi and Qigong is not something you get a certificate for necessarily. And I know there are places where you can sign up and for 2 weeks and a few pounds, you can be a trainer. Well, while I don't knock them, I know that they're in there for the business, but how do you know that who trained that person? How did that happen? So by having a standard, at least it gives us a baseline that people can work for, because we're all bound to do other things. It's going to happen. There are people that will be maybe know one or two forms, people that know 5 or 6, or don't have, in some cases, maybe some of the in-depth knowledge. I've spent a lot of time looking into a lot of things. I'm really interested in things, as Sam was talking about, that like the meridians and whatever, and I have connections within our world that I've learned a lot of those things from. I love tapping. All those sort of things need to come together to be able to make, and this is one way of making that happen, but also showing that we really mean what we're saying and what we're doing, because that's our key to getting into these places.
I think there's a possibility that SimSpa will become recognised by the government over this next 12 months. And if that happens, there is the probability that if we, as experienced complementary therapists, wish to go into a sports club or some facility, that maybe they will be turning around and saying, instead of saying, have you got a university degree to us? And we just say, no, we have experience of 20 years, and it falls on deaf ears, is that maybe they will be asking, do you have membership of the Chartered Institute for the Management for Sports and Physical Activity? And there will be signs put up on doors and saying SimSpa for swimming, SimSpa for personal trainers, SimSpa for yoga, SimSpa for Ayurveda, and there will be a number of activities. Now, this is a large organization with currently, I think, approaching or above 20,000 members, and is largely a professional organization. And so we can jump on to how do we work together with our friends from the Indian subcontinent and the Chinese, is that I sometimes feel that I recall a visit in South Africa when we were on a safari, and the gentleman running us around stopped and said, well, here's a dung beetle. Now I looked over and I looked at this dung beetle, and it was pushing a pile of poo across the road. Now, if there had been a camber on the road, he would have actually missed it and rolled it down. But he tried and he persevered. I am not personally a dung beetle, but I do persevere. And I hope that we can get agreement between our wonderful cultures. And in that sense, I'd like to finish on a couple of points, because I think that 15 minutes of specifics is more important than waffling around, as I sometimes do, is that views on collaboration between traditional Chinese and Indian health in the Western world. How do you see that becoming realistic?
It's a net. We hold different ends of the net, but we all meet in the middle because so many of the things are so connected. The Chinese say that Bodhisattva came across and went to China. So we all learn from each other. This is all of our practices are continual learning things. And just by being and working together, talking together, we're all increasing our skills so greatly that there is no reason why it shouldn't. I do a lot of breath work. I know that there's lots of brilliant breath work within the Indian world and in the Chinese world, and I just like to combine it all because there is no reason why we can't do that. And as we all know, breath is the beginning and the end of all of us. So things like that are so important that why shouldn't we be doing it? What's the reason not to?
Okay, right. I think that the challenge is there. And one of the difficulties that I face is progression management, succession management. I have no qualms about saying how do people follow us. There are so many critics, so many martial artists who want to have their say in a negative way, and so we have to change minds. I'm delighted to see a very good friend of mine from Santa Barbara here who's going to follow me. Hi, Roger. And so Roger and I are dealing together in a certain way, and I'm just about to hopefully set up another Zoom or a communication with him before Christmas. But I feel that collaboration is a major source of irritation to many because they think we're diluting they think we're actually affecting. And it's the opposite. We are strengthening. We are recommending across the world. And I'd like to just reiterate that if we wish to deal with the NHS in the UK, we have to provide evidence. We have to provide professional standards. It is necessary to also identify what is it we can do for the general public and how do we encourage them. We have been serving our locals and people are making a living out of it. Why shouldn't we make a living? I think that, like all other activities, we're not professional doctors. We are people who would want to work with professional doctors. I am delighted that since 1947 or 48, we have had the National Health Service in this country. But it's breaking apart, and maybe we have individual views. But working with them is so important. It has to be broken down. And I've just noticed a note from Mita, thank you very much, is that she's using professional standards in the schools. I'm going to finish on promoting a session of Tai Chi and Qigong on the 23rd, Sunday the 23rd of February 2025. And I pay tribute to the people at Healing Earth to give me 4 hours of that session. And we have speakers and a table out. And the subject primarily will be supporting an initiative called Global Transformation Project. This project is an initiative of a guy called Bill Douglas, who you all know probably. And it is about introducing mind, body, and soul techniques into schools, into the education system, going from the UN right across the world. And so I think another good source of data from the NHS on ROI is yoga. Fantastic. And I think we need some commercial knowledge here, Mita, in as much as it, to understand exactly what we mean by investing a couple of 100,000 or a couple of million and what we can get back out of it, and getting those in the powers at Whitehall or in Whitehall or in the ministry to accept that. And I would thank you again to Neil and to the team at Healing Earth. Frank, I'm delighted to see you up and well. You may not know
Thank
it,
you,
but
Keith. Before you move away, wait. We let's have a last comment. I would like to just ask Sam to align with how yoga and Tai Chi blend into the system, and I think we all have the same concern of how to mainstream these alternative systems of medicine and how to bring them on a track of this global transformation project that Keith you have all started with. And to align with that, because all of us talk on the same line of validating and evidence-based research to be a standard for putting forward at NHS and various other health systems globally so that they get a validation. So what is your take on that, Sam? You have been practicing yoga. You have been into so many things, and staying in Scotland, what is your observation of what best can be done to align all these therapies together? Over to you.
The thing is, going to NHS or even I went to the schools, primary school. I was a yoga teacher for primary school to go and take classes. And then there was a public outrage that I'm teaching religion. So people have a different concept. They think yoga is something else. Same thing. So we have to, and also we have to train the doctors as well. Even NHS agrees something. If doctors don't know anything about it, they won't recommend to the patient. So it's a big task. It's not, so best way is to actually, like what I'm doing, development courses, go and do courses, get a sponsor of the council and do free courses for public around the town, all around. Like Diabetes Day, I went all over the UK, went to different GP practice. They brought all the patients together for diabetes, and I talked about yoga and lifestyle, what to eat, things like that. It's like it's something will take 25 to 50 years to develop. It's not something happen overnight. Even if you get something from the government, until the public believes in it, it won't happen. You have to. It's a slow process. That's my way of thinking.
It very much is. It very much is. And as you say, doing those special things. I did a class in a special school here on Friday, which is all the neurodivergent children in our area that go to this particular special school. I did a class for the sixth formers, and the assistants that came in with them said, "We'll see if they last the hour." And I had them in 10 minutes. I had them all joining in, even those were seated, and they were laughing and smiling. I made it lovely and simple for them to understand, and they glowed and enjoyed it, and they all wanted to come up too close to me, so it was really difficult because they just wanted to come towards me. But it does make such a difference.
But one thing I've learned is children or even adults, everybody's telling them to do this, do that, but they don't listen then. You have to ask question, what do you want to achieve from this? Like when I went to school, I told them, hey, who wants to gain height? So out of 40, 20 people put their hand up. So I told them, yeah, what kind of food do you eat? Then what do you do to make your bone? You have to take the sunshine to convert vitamin D, to make your bone stronger. Eat the milk, take all the vegetable to grow stress. And then I said, do these 5 exercises, Tarasan, Chakrasan, Sarvangasana, all that. And they were doing it because that was their problem. You have to give a solution to their problem. That's how we connect the public as well. Everybody has problems.
If I may, is that with regard to the Chartered Institute, is that I'm dealing with an old friend of mine, Mark Peters, and also the director in charge of progress at SIMSPA. And I've been agreed to have a meeting on the 9th of January with them, because we need to understand what the aims, the visions, the objectives, timescales, opportunities, threats, and all those good things. And with this 3-person team is that we hope to actually define some of this so that when we're ready on the 23rd of February, we'll have some plan that we can show, because the 3 of us will be presenting I suppose a question and answer. Where are we? What do we need to do? And how are we going to achieve it? And therefore, it means then that we need to work to some form of plan and to some form of standards. So I'm going to hand back to our lovely Amrita and let other people get on to the show, especially
Yeah, definitely, Keith. We have Dr. Roger with us, and you are very well familiar. So let's have the comment from him, and our lovely Sharon is also here with us. So we had been waiting for her, our senior host. Yes, Keith, could you please have some comments that we can have for Dr. Roger, and then we move forward. Over to you.
I have been dealing with Roger since 2006.
Global namaste to both of you.
Yes, and I had the pleasure of meeting him in Scotland, and I was taken aback. And we had lunch, and he will remember, as I think he will, is that as a typical American, he said to me, "What is it you can do for me, Keith?" I had no idea. I had no idea.
He always asks me what he can do for me.
Yeah.
He always asks me, what can I do for you?
Is that in 2012 we met again, and we agreed on a small agreement between us. I have the utmost respect for this gentleman. I look at his programs. He has personally signed the books that I have from his organization, The Power of Chi. Wonderful. All right. And I'm honored to introduce Dr. Roger Yanker, Oriental medical doctor. Also, he was a founding member of the National Qigong Association, of which one of the people on the organization we're dealing with on an international basis. Roger, delighted to see you, smiling. And we both had slightly different colored hair when we first met.
Thank you so much, Keith, and good morning. Morning here.
Good morning.
Sharon, and greetings everyone. Sharon, please, I'm going to let you be the guide.
Okay. Well,
Yes.
first of all, I'd
Sharon,
like
over to you. And please take over. Thank you so much.
global namaste to all of you out there today.
Namaste.
It's a beautiful day and a great topic. And I brought my dear friend, Dr. Roger Yonka. From the moment we met, when I didn't even realize I was beginning Quantum Chi, the film, that is really created, and it's coming in the spring out in the world. And it was to really, you know, after years and years of yoga, you all know my background, I found Qigong. And the two of them integrate so beautifully together. These two movement, spiritually oriented, breath oriented healing forms. And from the moment Roger and I met, it was like we'd known each other for lifetimes. And he's become an associate producer of the film. And we're very excited because it's coming forth soon. But I want to introduce him specifically. Dr. Roger Yonka, OMD, has dedicated his professional life to sharing the powerful ancient healing traditions of China. He is the director and chief instructor of the Institute of Integral Qigong and Tai Chi, Santa Barbara, California, and a founder and recent chairperson of the board of the National Qigong Association. With almost 30 years of clinical practice as a physician of acupuncture and traditional Chinese medicine, and 10 search tours to China, Dr. Yonka has emerged as a key spokesperson for Tai Chi and Qigong and is a master teacher of these arts. He has studied hundreds of forms of Qigong with master teachers and visited numerous hospitals, institutes, training centers, temples, and sacred sites in China, focusing on the cultivation of Qi. Dr. Yonka has presented at major conferences on advances in complementary and alternative medicine throughout the United States. He has lectured on self-healing and emerging trends in healthcare and medicine to numerous hospital systems and healthcare associations, including the Healthcare Forum, the Catholic Health Association, the American Medical Association, the National Wellness Institute, Stevens Point, Wisconsin, and the American College of Healthcare Executives, Chicago, Illinois. Is contributing author to numerous books on health promotion methodologies for both clinical providers and healthcare administrators.
Thank you. Wow. So just a brief statement and then feedback from you, Sharon. So I understand that our topic today is the whole concept of healthcare, universal healthcare. Sometimes here in the United States, we talk a lot about universal healthcare being a right, and what healthcare means in this society here is financing medical intervention, which is, you know, like, why would you call financing medical intervention healthcare? It doesn't make any sense. So when I say healthcare, I mean caring for health, which is something that people do at home for mostly no cost. Like take a deep breath now, how much did that cost? Adjust your posture now, how much did that cost? So I'm not inclined to want to discuss the whole concept of how we can have governments pay for medical intervention, because I know there are accidents and so forth, but chronic disease is completely preventable. And everybody on the line right now is a warrior for that idea. And so as we organize ourselves as a massive, for like a massive assault on chronic, preventable chronic disease, how should we go about it? So I recently gave a presentation at a large conference, like a keynote presentation. The name of the organization is the Academy of Integrative Health and Medicine. And that organization is all about this assault on chronic, preventable chronic disease. And so in a few moments here, I'm going to show you a little bit of my presentation for the keynote to that event. But first, let's just have Sharon come back in with, her idea. Like, what do you, as good friends, we're all good friends of this idea, obviously, on this call. I hope we're, we're recording this and, blasting it out to the world. But Sharon, like, just from your own heart, and briefly, and then we'll talk a little bit more after I show a few slides, what are you thinking about all of this?
Well, these days, I'm incredibly enlivened by there seems to be a desire in this country to really look at the healthcare system, how we've been, the food we've been eating, the way that we heal ourselves, the way we help to heal each other, the pharmaceutical industry, the Western medical profession. And there seems to be a great longing for really integrating all of these systems, such as traditional Chinese medicine and Ayurveda, systems that to me have really studied what they call the science for thousands of years and have so much to offer to us as human beings, particularly our children. Both Ayurveda and TCM really go deeply into diet, nutrition, and it's time for us to really bring that not only to the ones that are here on Healing Our Earth who are probably aware of these things, but to the Black community in Chicago, or the Hispanic community in Chula Vista, California. It's time to really, on every level, move from a kind of low vibration or frequency in terms of letting our thoughts and emotions and anger and kleshas and these disturbances really blind us to the beauty of life and the opportunities that are available to us, and move to a higher frequency of course, love, compassion, giving, caring. And I know you have so many words of wisdom I've heard over the last, it's like about 7 years now. You're one of the most articulate and knowledgeable of the Qigong and Tai Chi practitioners that I know, and really understand how this issue and how to make the knowledge of it and the potential of it available to the Western world.
Cool, cool. Yeah, so let's do that. I'm going to just jump right into some slides here. This is the program that I presented at this recent conference. It was attended by 500-600 policymakers, people who are in charge of institutions, the leading thinkers of the chiropractic, osteopathic, massage, Chinese medicine, Ayurvedic medicine, homeopathic medicine, herbal, and on and on. An amazing event. And I want to be sure that you are seeing these. Are you seeing these slides?
Yes.
Okay. So my job at this event was to basically make the case for both the efficacy of accessible mind-body practice, and the potential financing, the powers of the potential financing, and then finally methodologies for dissemination. And so just briefly, wanting to show the credibility of these ideas, these are the organizations that I have been hired basically to give presentations on the body of knowledge that we'll be discussing here today. And it's why I show this slide is to so you know that the attention is swinging. You know, my earliest presentations to these organizations were in the last millennium, so attention is swinging slowly. So we want to transition from a disease-oriented medical intervention system to the whole person health and resiliency maximization system, which is inherent to all the shamanic and indigenous tribes. And the underlying foundational idea is that the most profound medicine is produced within the human system, the mind-body system, or we could even say the mind, body, and spirit system for no cost. So my intent with these slides is to prove that, or to demonstrate that in Western medicine, we wait till people get sick, and then we give them expensive treatments. In Asia, or all the indigenous cultures, there is a similar idea where the treatment, if you want to call it that, is to resolve pathological, just the pathology, whatever the disease that has overtaken a person might be. But all of the ancient traditions have a second kind of medicine. It's not based on sickness that's diagnosable. It's based on this concept in China would be called maximize the righteous qi. In Ayurveda, it would be called maximize the righteous prana. And my little note here says that Western medicine is trending to wellness. However, we're very early in that trend. This is one of the books that I wrote called The Healer Within, and it's still a bestseller in the health category, and is used by schools, hospitals, institutions, universities, social service agencies, and so forth, because it presents very simple mind-body practices. Here's an interesting thing. Try to see if you can just let this in and then think about how cool it would be if we could spread the word on this. Anything that you can do that you rarely do, when you do it, it will be good. And so let's just think about this for a moment, because I'm not talking about doing harm to yourself or others. I'm talking about things like modify your breath, go ahead, deepen your breath, modify your posture, lengthen, lift, redirect your mind, doing eye exercises. Whoever does eye exercises, and yet when you do eye exercises, it has a benefit. Brush your teeth with your non-dominant hand, make new choices aligned with your personal preferred outcomes. So then this leads us into something called hormesis. Hormesis being an adaptive response of cells and organisms to moderate, adaptive response to cells and organisms to moderate, though, I'm not sure what this is saying, but the point is that doing things that you don't usually do, which put a kind of stress on your system. If you think about brushing your teeth with your non-dominant hand, you notice how clumsy that is. When you think about doing a breath modification, you notice that you hardly ever do it. When you think about modifying your nutrition cycle to include periods of fasting called intermittent fasting, how clumsy is that? How much is required to be able to rethink things so that you can do intermittent fasting or even more lengthy fasting? The turning on the cold water at the end of a shower, all of those kinds of things. And then another beautiful new concept in science is called interoception, the ability to sense and perceive the body's internal state, including physical and emotional sensations. So think of the definition of the word feeling. Does it mean physical feeling, or is it emotional feeling? Well, no, it's neither. It's not an or, they're both. The word feeling is used to describe both. Well, what is feeling? Well, the new science word on feeling is interoception. In other words, being self-aware. And when I get angry, am I just angry, or am I aware of the fact that I'm angry, and do I have a plan for how to navigate the fact that I'm angry? When I feel pain, do I just go to the pharmaceutical, or do I think myself into a plan, a strategy, something that I thought about and have made some thoughts, put together some thoughts for how I'm going to progress as I experience myself experiencing pain? So mind-body practice is a portal to this whole realm of purposeful, self-initiated, interoceptive training. 4 archetypal dimensions of mind-body practice, right across all the cultures, Tai Chi, Qigong, yoga, Kung Fu, any of the practices from the shamanic traditions of the Druids and the Celts, the Siberians, the Africans, the Australians. All those cultures have these in common. Body practice, lengthen your spine, drop your shoulders. Breath practice, deepen your breath. Mind focus practice. Pay attention to how distracted you are and make a plan for how to become less distracted. Self-applied massage. Yeah, you can get a massage. You could prefer to have a massage from somebody who's going to charge you, 100, 120, but you can also do massage on yourself for free. So these systems are all really one system, which has to do with this idea that every one of these cultures distilled these methodologies. So let's focus on breath practice, only just briefly, just to describe. My first experience of conscious breath practice was 1963. I used to skip school and watch TV all day. And one of the shows that came onto a local channel was a yoga show. And so I would do yoga while skipping school, and the teacher, of course, would talk about breath practice. Over the years, I've distilled breath practice into a little program that I call breath medicine. And basically, what it does is that it distills every kind of breath practice that has ever been developed by any culture in the world into the essence or the distilled archetypal foundation of 2-part breath, 3-part breath, 4-part breath, 5-part breath. I'm not going to do a lot with the specifics on that, just pointing to it. But let's do one example practice, and that's just simply 2-part breath. Well, we're taking a 2-part breath every time we breathe. In, part 1, out, part 2. To make that into something conscious, we usually deepen and lengthen the breath. So the conscious breath, the 2-part breath, is our usual breath pace is 16 to 20 breaths a minute. Conscious breath pace is going to be somewhere between 4 and 9 breaths per minute. So how you do it, and let's do it now, and I'll just use my hands to guide us as to in and out. So a long, slow, deep breath, which has the nickname LSD breath. Let's do it now. Breathe in slow, slow and long and deep. And then exhale very, very slowly. The research shows that if we make the exhale longer than the inhale, it increases the extent to which we have an effect on the vagal aspect of the autonomic nervous system, which is the parasympathetic nervous system, which is based on the molecule choline. So as we're doing this, let's do it one more time. Breath in. Exhale very slowly. And just doing that 1 or 2 or 3 times will actually increase the productivity of choline-based neurotransmitters, which include oxytocin, which is the trust one, and then the other one, anyway, there's all these cool neurotransmitters. It's hard to remember all these things all the time. You know about this, but let me just show you this. The bottom one, belly breath, when you breathe in so deeply that your belly expands, that's actually accelerating the function of the lymphatic system. And the lymphatic system is the waste discharge system of the body. So the cells are metabolizing and creating metabolic waste all the time. How does that metabolic waste get out? In the lymphatic system. Well, how could you speed that up? Belly breath. And then the chest breath is like, oh my God, what a miracle. When you fill your chest, the one on the left is referring to the stretch receptors. Stretch receptors. And when you breathe in a large enough breath, and by the way, 16 to 22 breaths a minute does not stretch the stretch receptors. When you stretch the stretch receptors, it creates a signal to the brain, and then it releases choline-based neurotransmitters, which are medicine. And then the one on the right is that in the cardiac system, which is inside the rib cage, and when you take a big breath, a big chest breath, the pressure increases inside of the thoracic, inside of the rib cage, and creates a pressure onto what's called baroreceptors. And those baroreceptors are also sending messages into the spine and the brain to release choline-based neurotransmitters, which are like the medicine within. Now, I'm not going to linger here because I want to keep going and just reflect here on this idea of elixir. You cannot, in both India and China and for all the other societies, when they speak of the highest level of medicine, it's not something that you can buy. It's only something that you can make. The most supreme elixir is nothing other than the capacity to purposefully sustain mind focus to make self-maximizing choices. Now, how incredible is that? The most profound medicine is produced within the human body for free. The highest level of that medicine is the supreme elixir. How do you get the supreme elixir? As you make a commitment to self-maximizing choices. It's all about the mind. By the way, does the mind decide to take a deep breath? So, you recognize this picture here with the Tai Chi symbol in the middle. I won't linger here because I want to just keep going so that we can get to a little conversation. So when did the Chinese come up with this? Earliest evidence is not that long ago. Scholars estimate that it could be as much as 10,000 years. But think of it. The human gene is 3 million. 3 million years. Humans have been evolving for 3 million years. Why would we wait until 10,000 years ago to talk to each other about how we feel and then do something about it? I mean, it's just, we live under these repressive assumptions. It's just ridiculous. Same with yoga. Evidence is, you know, back to whenever somebody could see something in writing. But what does writing have to do with humanity? Writing, well, it has a lot to do with humanity, of course, but there was a long time before the humans started writing. And my personal view is that these things were happening 500,000 years ago, maybe more. So we did the conscious breath. Let's talk about the money. If a person takes care of themselves, it's just like a dollar, one, you know, what we call it a dollar. There's $1 there. What's the dollar for? Well, it's like buying yoga classes, getting an organic cucumber as opposed to a you know, like a factory farm cucumber. Well, what about the $3 signs? Well, that's when the culture decides to spend money on disease prevention. And what's the one at the top? That's what most of these quote advanced cultures do, which is just treat people. You know, wait till they get sick and then treat people. It's ridiculous. This is a whole plan for how clinical practice can go. And if anybody here is interested in getting into a deeper discussion about this slide, you know, send me an email. I'm sure that somebody will post my email address. This is a paper that I wrote with a team of people. It was published in 2010, a long time ago, about Qigong and Tai Chi and safety and efficacy. And we're all on the same page about how cool these practices are. So I'm not going to linger here. But let's look at this. From 1990 to 2010, there were randomized controlled trials, RCT. Randomized controlled trial is like what they call the gold standard in research. So between 1990 and 2010 on Qigong and Tai Chi, randomized controlled trials 77, that's an average of three a year. So over 20 years, 3 a year. In the next 5 years, there were 30 a year. So money, intelligence, insight, and policy are creeping in the right direction. This is just some beautiful, beautiful science about telomeres. I'm not going to linger here. This is another study that we did, and it's just interesting because people said, 89% of the people said, I liked doing this class. 91% said they would do it again. Now, what are the 2% of people who didn't like it are going to do it again? Why? Well, because it's either a social activity, they meet people that they like, or they feel better. Maybe they didn't like doing it. Maybe they didn't like it was Tai Chi. Maybe they're like, you know, have something against, you know, things from far away. The point is that lots of people have positive experiences with all of this. I'm not going to linger on policy because I think we want to have some chat about this, but this is an event that myself and a bunch of other people did in back a ways, I forget the date. But a consensus report from a national expert meeting can have influence, and it has had influence. It's had an influence on our Veterans Administration, and it has had influence on what in America we call the Affordable Care Act, which gets a lot of bad press because of the fact that it just biased to having the pharmaceutical companies, the government buy drugs and give those drugs to people for free. I mean, it's like, that's so screwed up. These are some papers that I wrote. We won't linger here. This is the amount of expense in the last years. Just look at how that's crashing upward. When I first started giving these lectures, that number was 1 trillion in the United States. It's now 400 times that much. And let's don't linger on the elixir breath, although it's very powerful for insomnia, which is one of the worst chronic diseases and contributes to horribly to chronic disease being worse. This slide, we think how horrific it is that the military and industrial complex is having all these wars all around the world. But listen up. The cost of healthcare in the United States is 400 times the cost of war. I mean, 4 times, however you want to say it. In other words, the cost of war is about 1 trillion annually right now. And the cost of healthcare, quote, healthcare, is 4+ trillion right now. So if we were to do the thing that we all know we could do, the US could reallocate 75 to 90% of $4.5 trillion. That's $3.5 to $4 trillion that my society could do to put art back into schools, recess back into schools, repair bridges and highways that aren't working, and pay for amazing Tai Chi and Qigong and yoga classes for everybody in the United States, and even build a place for people who can't earn a living to live. It's just disgusting how the the industrial complexes have abused humans. So how are we going to do this? Train all these people. We won't linger here. You all know about self-applied massage. So our Centers for Disease Prevention they have a whole page on Tai Chi and Qigong. Our Veterans Administration, a whole page on Qigong and Tai Chi. My organization has trained 4,000 plus teachers and leaders, and they're all over the United States, and there are many of them from India and from the UK and from Europe and so forth. This is just the map for the US. And so here's how we are doing it. We basically teach people to be practice leaders, and they go back to their communities and they lead these classes. And there are, we're associated with a nonprofit called the Healer Within Foundation that helps to make these things happen. So I'm going to unshare, and I'll let somebody put my email address into the chat so that we can just go right to Sharon. What are your thoughts?
Well, the first one is that just something I've been talking about and thinking about. As you mentioned, the we would say time-honored ancient traditions, these traditions. And I've been looking at, pre the word Qigong, which isn't too popular right now in China. This practice was called Daoyin. And in looking into Daoyin, I noticed that there was a big influence from Buddhism that came from India into the Taoist tradition. So me, I'm always looking for, where do we all meet? How did one great culture influence and merge their teachings with another to create even something more exciting? And then as we look deeper, I was doing this with my musician friend, Jebing Chen. She told me that in the Chinese description of Daoyin, says that some of it even came from dance. And so I found that really fascinating, that this journey that I personally have had from the dance of India, right, into Qigong, that dance plays always an important part. And I'm always, because of all the work I've done in schools, that I'm always wanting to add dance and rhythm to these mind-body practices, because it really, especially Indian dance, it has really, lots of eye exercises. Your hands are doing one thing, your eyes are doing another thing. You're portraying a deity, and it's an incredible healing art and really good for your brain and your nervous system. So I just feel like we are very good friends with Bill Douglas and are working together with Bill Douglas, who's been on the show many times, and Clara Apollo, to create some kind of forum where we can really focus on these kinds of teachings and bring them out into the world. And Bill Douglas with his Global Transformation Project. You're there, right? Hi, Bill.
Yo, Bill. All right, so
hear you.
All right, now I'm unmuted, I think.
Oh, so
go ahead.
So please go.
Yes, I'm so glad that I tuned in today. Sharon, what you're saying is so right on, and Roger, what you just talked about we're at a place in history where we can have a huge impact on society, and Roger speaks from his own life experience and wisdom, because Roger worked with the National Council on Aging to create an efficacy guide. He was the engine behind this. And I know from my World Tai Chi Day organizing and connecting with Tai Chi teachers all over the country and the world, that Roger had a huge impact on expanding Tai Chi into senior programs all over the country. And this has saved the country a huge amount of money. I did an informal study on my own Tai Chi class at the University of Kansas Health System, and I had saved the state of Kansas millions of dollars in saved health costs. And so what Roger did, oh my God, that saved so much money. So we're at a place right now where the science backs up everything Roger talked about. We could transform our society. And what we're doing with the Global Transformation Project is everybody can sign the petition at globaltransformationproject.org. And when we get 100,000 signatures at least, I think we should be able to get millions when the mind-body community really grasps what it is that we're doing. And then the goal is to get a United Nations resolution advocating non-binding. Nobody'd be forced to do anything, but it would use the UN as a vehicle to spread the science that we have. Roger spent his life doing science on these incredible practices, and other really, really courageous people. And so we can take this science and the reason that I know that we could get the United Nations to do this, the General Assembly to do this, to vote for this, so that we could use it to educate education professionals all over the planet, that mind-body should have been in public education a long time ago, is because in 2014, the United Nations General Assembly voted to create the International Day of Yoga. And that was voted on by a record number of co-sponsoring nations, 177 co-sponsoring nations. So it was the most popular thing in the world, in the United Nations, to get yoga out to the public. And so we have this science that shows it makes kids smarter, it lessens bullying, it improves their education ability on every level. And then while it's doing that, it's saving society. Like Roger said, we're talking trillions of dollars if we were teaching kids mind-body practices. So what we're advocating is the ones that have the most science behind them is Tai Chi, Qigong, yoga, meditation, mindfulness. And we're not trying to make this program. We're not trying to manage it or be the teachers or anything like that. We're advocating for mind-body teachers all over the planet because they're already there. They're already there. All they've got to do is be invited into the schools to start sharing this wisdom of teaching kids how to go into alpha, brainwave meditative states. And the science shows that it would empty our prisons. I taught at Folsom Prison many years ago. And when I was there, I found out they'd had a program, a Tai Chi Chuck program for 2 years. And one of the assistant teachers had looked at the prison data, and they had brought down the violent incident rates, not just for the Qigong group, but for the entire prison. And that's backed up by science. So by getting this into schools, it would not only affect the schools, it would affect the communities and save trillions of dollars. And we're the first generation in the history of the planet that has had all this science. And, it's going to sound like self-promotion, but I just want to get the science out there, and I will give it away. If you get on the World Tai Chi Day, worldtaichiday.org newsletter, I will give it away at some point, but it just came out on Audible. It's the Gospel of Science, new 2nd edition. And what it does is it lays out all the science, and it's meticulously endnoted, so you can go see the sources yourself. And when you go through this case, if you walk through this case with me with this book, you'll be talking just like Roger Yonka was just talking. We can transform this planet. We're at a very exciting moment in human history. And to be able to connect with visionaries like Sharon and Roger and Nil and people that, understand that it's way past time that this was being taught to public education students. It's very exciting.
Yo, Bill, thank you so much. Sharon, you're the orchestrator here. Do you want to weave in some of our colleagues?
Well, let's bring in Neil. Looks like he's coming. Hey, Neil, global namaste.
Global namaste, Sharon. Sharon, you always do a wonderful job by bringing so many exciting people. And of course, Roger has been on Healing Our Earth, and Bill has been on Healing Our Earth many times. Roger, you wanted to put your email address here. This is a private Zoom room. The audience are actually in the YouTube and a Facebook and a website. So I found a very interesting articles of you all over internet. And in the QigongInstitute.org, they have got a lot of information on you. For those people who want to connect to Roger, you can read his article on QigongInstitute.org. Let me tell you about Roger. He has been in this game for now over nearly 45 years, and maybe shortly will be hitting a half a century. Roger, you mentioned about you love Tai Chi, you love Qigong, you love Chinese medicine as well. Today, you hit on a very simple note about breathing, which is what God designed us to do. Naturally, we were designed to breathe. And Sam loves breathing as well because he uses breathing in yoga. You use breathing in Tai Chi, Qigong, and part of Chinese facilities. I would like to know what's gone wrong, because God designed us so naturally we could breathe. But nowadays, we need to teach people to breathe. They have forgotten to breathe correctly. Maybe they breathe naturally because God designed us, but we have got enhanced knowledge. So first, I want to ask Roger, you mentioned breathing. Of course, that means consuming nice level of oxygen and
yes,
where there's a lot of oxygen. And then I'll go to Sam, because he is breathing into yoga. You are breathing into Tai Chi and Qigong. So Roger, over to you. Why breathing is important and why everybody should be listening to you, because it's a very simple, extremely simple exercise or a method you can do at home or in a car or when you're cooking or breathing or sitting or watching television. Over to you, Roger.
All right. So you are correct about everything that you said, and I think about these things all the time. And in my own mind, this is my theory for right now. So first of all, is there a God? Of course there's a God. It's like the wholeness of the entire cosmological show, whatever that might be. So then did that God, the wholeness of the entire cosmological show, create us to breathe? Absolutely, through whatever mechanism that may have occurred, whether that's the Darwinistic, biological, etc., selection and all of that. But when it comes right down to it, we do ask this question: if we were meant to breathe, then why is it that it's not something that people are paying attention to? And the answer is because of the fact that we don't have to pay attention to live. But then we get to ask the question, are we invited through a secret, a hidden idea that is hidden in plain sight? Are we invited by the God of the cosmos to evolve and to go beyond surviving at 16 to 22 breaths per minute to thriving at less than 10 breaths per minute, or when we do some of the really breath holdings practices, maybe hold your breath for 2 minutes in and maybe hold your breath out for 1.5 minutes. What happens then? And what happens then, so we already talked about what happens when you just take a deeper, longer, slower breath, an LSD breath. You already get all these flooding of medicines that are produced within the body. But also, there's the exposure, the increased exposure to CO2 is very powerful. The increased exposure to nitric oxide, both which are increased under the influence of certain types of breath practices. So not only do we have the ability to calm down and produce neurotransmitters that are healing neurotransmitters, but we also have the capacity to use the breath to put ourselves into hormesis. Hormesis being low levels of stress which build overall high levels of resiliency and what we can call homeostatic capacity. So when you expose yourself to just carbon dioxide, you die. But if you expose yourself to a little more carbon dioxide than usual, you do not die. But what happens is that an array of adaptive mechanisms are triggered within the human system. And when those adaptive mechanisms are triggered within the human system, it actually causes us to have a higher level of resilience and a more rapid capacity to re-achieve homeostasis. And then, so that's the CO2 part. The part with the nitric oxide is that nitric oxide is being produced by a miracle of the cosmological source of humans in the nasal passages all the time. So what is nitric oxide for? Nitric oxide creates what's called dilation. So when we breathe in through the nose, nitric oxide goes into the lungs. It then supports the dilation of the alveoli. And if you imagine that if I can increase the volume of my millions of alveoli by a tiny little bit of flexibility, could I then take a deeper breath? And therefore, could I hold my breath longer? The answer is, of course, yes. But the most important thing is that nitric oxide is then passed from the lungs into the blood along with oxygen and so forth. And now it has a dilation effect on arteries, arterioles, and capillaries. Now, what is the biggest killer? Heart disease. What is the most intense aspect of heart disease, or the most deleterious aspect of heart disease, is arteriosclerotic processes, arteriosclerosis. Well, what does sclerosis mean? It means stone. So arteries and arterioles that are turning to stone. Well, why are they turning to stone? Well, the dumbass medical part of the world would tell you, well, you're just aging and that's what happens. But if we realize that when we eat these manufactured foods, or when we eat even fresh foods that are GMO and grown on manufactured soil, there are many effects that have to do, and of course inflammation and sugar and all of that, all have to do with turning our arteries to stone. So we want to do everything that we can, nourishment and movement and breath practice. And you know, the part about what they call high intensity interval training, where you run for a few minutes and then you stop and do Tai Chi for a few minutes, and then run for a few minutes and then do Tai Chi for a few minutes. Interval training. All of these things have to do with expanding and contracting and expanding and contracting the cardiovascular system. And the nitric oxide is one of the most powerful medicines that we can possibly take. So just one more thing about that. When you breathe out through the nose, this is classic yoga question. Should I be breathing in or out through my nose or in my mouth? Well, answer is, you know, I mean, there are many, many master teachers on these things. My answer after all these years is always breathe in through your nose. But then when it comes to the breathing out part, what is the difference between breathing out through the nose and breathing out through the mouth? Some research and my personal experience suggests that when you breathe out slowly through your nose, it has a powerful effect on the autonomic nervous system, tilting towards the parasympathetic. But when you breathe out through your mouth, it doesn't do that as efficiently. But what it does do, when you breathe out through your mouth, now the amount of nitric oxide that's accumulating in your nasal passages is increasing, because instead of blowing it out because you're breathing out through your nose, you're breathing out through your mouth. And then when you breathe in, you get a double dose of nitric oxide. So we could go on, but you know, thanks for
Roger, thank you for your personal experience. So for all those who are listening to Roger, and if you found it complicated, Roger is simply saying, sit naturally, close your mouth, your nose will do automatic breathing in, breathing out. If it doesn't do that, either your nose is blocked very heavily, in which case naturally you will be breathing in and out from your mouth, which is a spare zone. Try to breathe in and breathe out from your nose as much as you can, is what Roger is saying, and you will naturally feel the benefit. And Sam in Scotland, of course, practices this with what is called Anulom Vilom and Kapalbhati by blowing it out and exerting even more. Sam, your comments on what Roger said and how you put it in your style, but using yoga.
That was excellent, Roger. But I'd like to add nitric oxide. It's a colorless gas. The way it behaves is, if you take a straw in the soapy water, you blow, bubble comes out, and after a few seconds bursts. That's how nitric oxide behaves. So when nitric oxide in your blood vessel, it sits on the surface. So once you make the blood flow faster, creates a vacuum, and nitric oxide gets sucked into the flow, and when it bursts, it dilates the blood vessel, and your blood pressure goes down. And also it helps to break up the plaque, and also it helps to give you more stamina, because more oxygen can absorb in your muscle and cell, and that's what nitric oxide does. So nitric oxide is like and also they gave that in COVID-19 as well. What I used to do, I was teaching them since before COVID, cover your eardrum, put your tongue near the teeth, and do humming sound for 5 times. That will produce more nitric oxide in nasal passage. 50% more nitric has been proven scientifically. So that means every time you go out, you should come back. I said to them, wash your hand, everything else, and then do bumblebee with the tongue near the teeth. Let the vibration go in nasal passage, produce more nitric oxide. That will kill the virus or weaken the COVID-19. So when it goes inside you, your antibody can fight it and kill it off. So you won't have the effect of COVID-19. So that was a very strong, but the problem is the drug company didn't want to sell nitric. When we talk to doctors, nobody talks about nitric oxide. You have a high blood pressure, they'll give you tablets. But if you give me nitric oxide exercise, automatically my blood pressure will come down. And obviously, it's the Neil asked me about the breathing exercise. Okay, and Mitaji, do you feel hot all the time or cold all the time?
I feel cold all the time.
So I can guarantee when you go to bed, you sleep on the left side.
Okay, that's a very good. Today only we are having a snow around, and I'll be following your advice
No,
to
but left
sleep
means
on the
when I
left
say
side.
when you sleep on the left, you breathe from right. That heats the body up. Like I'm feeling hot all the time. I always sleep on the right side to breathe from left side. Yeah, why God given it two nostrils? Why no one? One right side is sun, heats the body up, left side cools the body down. And that's and so really it's all about autoimmune disease. You know, it's like a balancing the so Ida and Pingla energy goes to the base, to the spinal cord, Muladhara, Swadhisthana, they climb as it climbs up, your whole body starts to behave differently and energize all the nervous system and things like that. But the pranayama plays a big part. Since the COVID-19, see, when British ruled India, they saw the benefit of yoga. They stole the hardware. They forgot to take the software. That's why Baba Ramdev is saying you need the software. Without that, your hardware is no good. And since the COVID-19, they realized first the benefit of pranayama is because lung need to be strong, lung need to be healthy. Because if you want to stay long and healthy, you have to breathe properly. That's what the prana enters the body. So breath is the main vehicle for prana into the body.
Definitely. And it's the only cord that connects your body and the soul. Once it's gone, it's gone.
And Amrita, what are your views on what Roger said and Sam? And I reiterate that breathing correctly is very important. Don't panic. It's not something that you need to get education with as such because you were born naturally how to breathe and everything. But if you can muster more information and can breathe deeply as well, and Roger has explained from different point of view, Sam has explained different. You from Ayurveda, Amrita, how much is breathing important in people's life?
Yeah, definitely. I align with Roger's view as well as Sam's view. And Roger has put forward this aspect from the medical point of view is so important to understand the importance of carbon dioxide and nitrous oxide. How these gases are equally important. People don't know about it. They think oxygen is the only one, but then these two ways of different breathing can align yourself with a lot more things that your body needs, which is also incorporated in terms of prana. And Ayurveda had been talking a lot about pranic foods as well as the lifestyle amendments where your different types of air element, which is in relation to the vata dosha, which people say is pranapan saman vyan vayus that overwhelm the body from all sides, are the real caretakers of your body. They are the shielders of your body, which shield, and that is what aligns with Sam's view to guide you towards Ida and Pingala and Sushumna Nadi, that helps you to enhance your energies, not only at the gross level, but at subtle level as well, on the pranic way to move forward for the higher realization and what is called as the purity and sattva. And so it basically starts from the physical self and it moves further at various levels. And add to that, I think Dr. Naveen Gupta, the Ayurveda Acharya from London, has recently joined us for this talk. And it's a very right time to hit the nail on the topic, which we have been discussing about the role of healthy life through breathing and healthy lifestyle. A very global namaste to you, Dr. Naveen Gupta, and a very good afternoon as well.
And before we
Kindly
go to
unmute yourself.
Before we go to Dr. Naveen Gupta, Sharon, you are a dancer. Breathing is very important part for dancers as well. In many shows, after people finish dancing, if I would like to plug them, I find that they are huffing and puffing because they've been dancing a lot. But some of them know how to quickly bring themselves back to calmness. What tricks did you use to apply, because you danced very hectically and very energetically, and then suddenly you need to speak. What techniques did you use so that you were able to speak coherently on the mic?
It really has to do with focusing the mind. And, when you are performing, at least for me, everything is heightened, and you're exchanging energy with the audience. You're giving out, they're giving back. And for me, it was just always a minute, because I would do all this fast footwork, tatkar, and lots of 21 chakras turns, and then have to speak. We have to speak anew, like da din din da da din din da da din din, and then go into something new. And somehow I was able to just focus my attention. But on another note, I wanted to bring in the fact that I noticed in my classes that people were not breathing, even early on as a modern dancer. I was trained in about like really using the breath when you dance. There was a whole thing about like falling and breathing out and breathing in and lifting up in modern dance. But what I started doing was I would have my class sing mantras. And so that the breath, because they were moving and singing at the same time, the breath had to keep flowing. And the mantras, of course, went with the movements. So this is what I've used in terms, and I've used breathing. I have a issue, what they call it, white coat syndrome. So when I go to the doctor, my blood pressure shoots up and they freak out. And so then I started working with a monitor, and through breathing practice, clearly, as Roger would advise, grounding first, really feeling my feet on the ground, getting really in my body, feeling that centered feeling, and then taking some very conscious breaths. I would feel like I could feel my blood pressure getting less and less, and I have it completely under control now. I haven't been to the doctor, so I don't know if it'll jump up again, but there are ways to use all of these incredible exercises clearly to help us heal ourselves. Maureen.
Thank you, Sharon. That's wonderful. Let's go to our next speaker who was lined up in our schedule, Dr. Naveen Gupta. Dr. Naveen Gupta, we are talking about how important breathing is in our life. So maybe a couple of minutes comment from you, and then your health tips, and then we'll go to Maureen, and then we will wind up for today. So Dr. Naveen Gupta, is breathing important for you in your life, and how much?
Breathing is breathing is like a switch. So when we are born, we breathe in. When we are gone, we breathe out. That's it. The whole life is between the breathing. So you can say soham, you can say hamsa, whatever you can say about the breathing. So when you ask me how, being a conscious person, being a conscious being, so breathing is the most important thing, and breathing is prana, and breathing. So nothing can exist in the whole universe without air, without wind. We say in Ayurveda, Visargadan vikshepai som surya nilastata dharyanti jagata deham kappita inalasta. So all are beautiful faces, but more Western than the Eastern, but also a couple of Eastern. So then I will translate this Sanskrit mantra, sutra, into English. So I spoke about Ayurveda, how important is Vat, Pitta, and Kapha. And like sun, moon, and wind carry the whole universe. Our universe, our human body is carried by sun, Pitta, moon, Kapha, and the wind, Vata. And then it further says, I don't have to say too much, but Amrita knows all these sutras by head, and I have to read something, but today I can also be speaking by head now. Pitta pangu, Vat Pitta pangu, Kapha pangu, pango maladhatva means that all the physiological states in the body are just lame. L-A-M-E, lame. Because to walk, you need 2 legs. Or to walk for the animals, you need 4 legs. Or there could be centipedes or millipedes, that's something else. So you need legs. Lame means you don't have leg. So anything will not function in the body without Vat. So Vat is breathing. And without Vat, anything not working. Mobility, motility, Vagati Gandhaniyo, the motion. So it's all about Vat. And Vat, you will get it only from breathing. So dear Neil Kumar, the leader of the Healing of our Earth, my answer to you is breathing is very, very important to me. Because
Thank
I
you,
came
Dr.
with
Naveen Gupta.
Yes, thank you.
And Roger said it very simply, breathe in from the nose and breathe out from the nose. Of course, he did, although he didn't mention, it was assumed that in case if you got a heavy cold or a blocked nose or you got some problem in your nostrils or something, your mouth is a bonus that God gave you, but breathe in from the nose and breathe out from the nose. You don't even have to do it. Just sit, close your mouth. You will notice your nose is breathing and breathing in, breathing out. So, Dr. Naveen Gupta,
One more minute. So the right side is the sun. The left side is the moon. गगन की ओट निशाना है, तिनके बीच छुपाना है, दाएं सूर्य बाएं चंद्रमा, गगन की ओट निशाना है. My aim is to the sky. On my right is sun. On my left nostril, with respect to Dr. Roger. So in my right nostril, I breathe sun. With my left nostril, I breathe moon. So sun and moon and the wind. And the wind will bring me to the higher consciousness, being an individual being and the conscious being on the earth. So I need to meet, my ultimate aim is to meet the super consciousness. And here I am. Thank you so much about letting me know that breathe in from nose and breathe out from nose. As Dr. Roger said, it's absolutely correct.
and you further clarified about left and right nostrils, which is very true. So, Dr. Naveen Gupta, today is a Universal Health Coverage Day. Basically, the theme for this year is that the government should either provide free health services and or subsidize health services. What are your tips and thoughts on that? And then we will ask Maureen in Canada.
And my first thought is that if they don't do the couple of things what you just mentioned, they should go. That's my first thought. They should go. So all the politicians must know that the health is the most important thing in the world, because without health, we cannot do anything. And then we have to understand the pillars of health as per Ayurveda. When I say as per Ayurveda, I have to mention to non-Ayurveda people. Otherwise, everything is Ayurveda for me. There is no need to mention me according to Ayurveda, as per Ayurveda. I'm 63 now. I'm 65 now, going to be 65. Anyway, so for me, I don't have to repeat again and again, as per Ayurveda, according to Ayurveda, because everything is Ayurveda. So beautifully what you just said, Neil ji, that it's all about political. They have to rethink about health, and they have to redefine the health. It's not just mere absence of a disease, which WHO says. Today I'm in Germany, but I'm traveling from Zurich today. So that means that WHO headquartered in Geneva, they say that mere absence of a disease. They have to learn. They have to learn, Neilji, from you and a little bit from me as your student, that it's not just mere absence of a disease. Health is the bona fide basic requirement. It's the tenet of life. So health means everything, because if you have health, then you know how to eat, then you know how to sleep and how much to sleep, and then also you know that how is your sexuality, because food, nutrition, sleep and sexuality, they are the 3 pillars of life. And the life, these 3 pillars will stand when there is health. And the next is that we are born for health, because Ayurveda says, Dharmartha kama moksha nam arogyam amulum uttamam. means to attain the religious austerity, to do the religious duties, to do the karma in the nice, beautiful way, as Sharon is doing. As Canadian Madam is Maureen is so much laughing, Meeta Joshi and Sharma and Lata Mirpuri ji, and from Scotland our resident panelist Mr. Sam. So, and Dr. Roger I mentioned 3-4 times, and he's so beautiful and looking so much energetic from US. So health is the foundation of everything, dear Neil. I hope I answered you in short minutes. Thank you.
So effectively, Dr. Naveen Gupta has said, health is of a paramount importance. If you are very rich but you are not healthy, what's the fun? If you are very educated but you are not healthy, what's the fun? If you are very dynamic but you are not healthy, who are you going to help? And at this point, let's go to Canada and we visit our Maureen, who is there. And Maureen practices IRT. But she has been on Healing Our Earth recently quite often. And thank you, Sharon, for bringing Maureen as well. Maureen, your comments about breathing, any tips you got for breathing and your health tips?
Yes, well, thank you. I apologize for being so late. I spent the last 2 hours with computer glitches and I haven't been able to get online at all until this moment. So I really will have to watch a replay because so much wisdom is here to enjoy. And especially I was looking forward to Dr. Roger. So I will catch you another time. And thank you, Sharon, always for connecting. So the breath, yes. And I came in just as you were talking about your blood pressure and focus, breath and intention. And we are the choosers. We are the commanders of our personal reality. And so to be able to take that responsibility, that ability to respond and take charge. And you may all know that earlier this year I had some health challenges with my heart, but it was very quickly healed. And yet it was a wake up to really pay attention to my self-care and my breath and do my daily awareness of grounding and connecting and breathing. And the breath, what is the breath? The breath, yes, it's life. The breath is our spirit. The breath enlivens us. And so the breath is source energy that rejuvenates, that heals us, that gives us infinite potential. So we are the breath. And we know without the breath, we are just a pile of, bones and flesh on us, a bag of bones on the floor. And so, yes, I appreciate the bit I've heard here. And yes, do whatever your practices are on a daily basis. And of course, some of you have experienced IRT, inner resonance technologies. And so that everything is contained in a single breath. That you choose an activation switch on your body, wherever it might be, doesn't matter where. And then with a breath, we breathe the breath of life and shift and clear our entire matrix from all times and places of unnecessary clutter, unnecessary static that's in our field. So it's an end result chemical formula that then we breathe with on a daily basis so that we breathe in and out our greatest health and our greatest way of being, our greatest selves. So that's, I guess, what I'm coming in with out of context of the whole in terms of my conscious presence here today. So I appreciate your invitation to say a couple of words, and I just love and respect all of you here, and I say thank you.
Thank you, Maureen.
Keep breathing.
Maureen.
Keep breathing. Consciously
Yes.
breathing. We just are wanting to be conscious and aware of our lives, of everything that we have that responsibility for to keep ourselves healthy with. So thank you.
So Maureen also says, keep on breathing. If you are breathing, you are alive. And if you're not breathing for more than 5 minutes, well, don't bother about it because you will never know what's happened to you. So keep on breathing. Breathing is important. Maybe pay attention to your breathing. Take deep breaths as well. If you don't be fearful, because breathing, the world at the moment has free air. Someday, sometime, if we don't take care of the world, we will also have to pay for oxygen. Some of the countries like Japan have started doing oxygen booths. And believe me or not, many polluted cities will be requiring clean oxygens very shortly. Maureen, you said you missed out earlier a bit, but Roger did a very good presentation, which is here. So those who want to see it, just rewind later. The links you were given becomes a recorded link. It is also broadcast on Sacred Mysteries. One of Sharon's website is gone on many partner channels. And shortly, we are now about to just wind up. Before we do that, Sharon, your thoughts of what has happened now and how Roger delivered a very nice presentation, and then with a chit chat with Sam, Roger, yourself, Maureen, and Amrita, and Mita's comment and Lata's comment. Sharon, your thoughts and your tips. Before you go, Sharon, you maintained yourself very well. What are the 3-4 health tips you can leave us with?
Go out in nature, breathe in the sky, feel the earth under your feet, feel nature, true nature nourish you. If you're sitting looking at a computer all day, take breaks and look out, take your focus out into space so that your mind and your eyes, your energy is not just, and you have from that intense focus that way, you allow your whole being to expand. And that will help your health from looking at, and make sure when you're sitting that you're not just hunched over and all day, but really become aware, particularly of your feet on the ground, your spine straight, as Roger talks about your breath. And then do what you love. Create. We're here to bring beauty and grace and healing to the world. So do what you love. Enjoy your life. And don't get caught in the toxic political realm, because that is really causing disturbances in this country, and it's just really sad. It's sad. But I do have good news in that, if you know that there's been a real push with Robert Kennedy Jr. and those around him to really bring a new level of self-healing and bringing in all these alternative traditions into our healthcare. And today there's an article that says the Food and Drug Administration is now going to be finally banning at least 6 out of 9 artificial food dyes in our food. So we are beginning, more than beginning, we're making a difference. And we have to really, or we want to really stay on this track to really help our children and all of the world be healthy on every level, not just the physical, but clearly the emotional and the mental, because they're so related, as Roger always brings forth. And I also want to say I'm very honored to be working with Roger and Bill Douglas and our dear Amalia Wai-Ching. You know, they have been my total teachers and support on so many levels as I go through this process of creating this film that we hope will bring the deep knowledge of these traditions, introduce them at another level to the West.
Thank you, Sharon. So Sharon says, you must do what you love doing the best. Do it. Don't just sit about and do that. So it's so important. And at this point, Sam, over 1 minute, what are your health tips before we wind up today? Best health tips you can share with us over 1 minute.
Learn to breathe properly. Deep breathing. But breathing out should be longer. So when you breathe out longer, you release the blood cell with all the carbon dioxide. then you can absorb more oxygen. So really, you breathe in for say 5, you breathe out for 10. So when at night time I can't sleep, what I do is I breathe in through my nose and breathe out through my mouth twice the length of breathing in. And that calms me down. Within 5 breaths, I fall asleep.
So there you are. Sam says, breathe, breathe, and it's going to be very happy. Maureen, I think you're waving. You wanted to say something. So over the next minute, what are your tips you've got for us?
Well, just one, and that is don't forget to laugh. Remember to laugh. And so I would love to invite Dr. Mita to please raise her mug to yes, bring joy into your life every day, and be deliberately happy. And happy for no reason is always a good thing to have. So that was my last word.
There you are. Be happy as much as you can. Laugh a lot. You can laugh at anything you like. Go and laugh. Go to a tree. Laugh at all the leaves, and the leaves will love it. Sharon, you wanted to make a comment before we move to Roger?
Yes, I'm reminded of our dear Dr. Effie Chow, who her prescription was 8 hugs a day, big hugs, heart-to-heart hugs, and at least 3 belly aching laughs. So I want to bring her energy and her.
Thank you very much.
For you.
Thank you very much. And Effie has been part of Healing Our Earth. Sharon is the one who brought her in, and it was so many times that Effie has been in here. And Amrita, just before we wind up, Lata, over a minute, what are your health tips, or how do you keep healthy?
I think it's a composition of things, and Neil, you always say keep smiling. I think that's one of my things now. I keep smiling at myself. I keep hugging myself, and sending out positive energy to everyone. And yeah, learning to breathe properly. And Mr. Sam is my yoga teacher and guru, so he makes us laugh all the time. You know, we have to laugh. So that's another thing to incorporate. Isn't that what you say, Sam? Dr.
Okay,
Sam.
so laugh, smile, and send positive energy. And Mita, over the next minute, what are your health tips and what do you practice to keep healthy?
So we discussed a lot during this session about yogic breathing as well, and the techniques which are fundamental to the physical and mental practice of yoga, and they are closely connected to meditation, which involves observation of the breath. So if also you don't believe in any kind of tradition of yoga, you just focus on your breath. If also you have to go and speak in front of 500 people who you never met, and you're feeling nervous, just take deep breaths, and that will calm you down, bring you to the present moment. And it's very important to be in the present moment. So breathing brings you back in the present moment. It also leads you towards meditation, and it influences the physical part of our body, heart rate variability, the mind, the relaxation, the stress. So we forget, we take it for granted that, oh, we breathe. But if you focus on breathing, there's several treasures of breathing, traditions available to us. And especially I come from the yogic tradition, been practicing since I was 12 years old. So yeah, but I do forget in the hustle bustle of life. So it's very important to remember now and then to sit down and just breathe. And as it was reminded to us, the nasal breathing is so important. And one of the most gentle breathing within the yogic exercise is you can breathe at any position, and it's called anulom vilom, or alternate nasal breathing. You can lie down just before going to sleep, just breathe and come back into the present moment, and most of your stress will be gone. So that's
Thank you. So Mita even loves breathing. Sam, your last comment before we wind up with Amrita over here.
Every class when I finish, I do a certain face exercise, which is very simple. Everybody said, oh, say, oh, E, ah. Come on, all of you. O, E, ah. And then go like a lion. And she go like a take a tongue out, you go, ah. Laughter is the best form of exercise. Thank you very much, Neil. Bye.
Thank you, Sam. And my tips just before we go to Amrita is very simple. Throw any anger from your body out in your mind. Throw it out. Throw any vengeance, throw any ego, and throw any hurt, because it's not going to let you go forward. If you can get rid of all this from your mind, you will be able to breathe happily, you will be able to be healthy, and you will flourish. Dr. Amrita Sharma, let's wind up with Gayatri Mantra. And thank you very much. Love you all. Over to you, Amrita.
Thank you. Thank you so much. Thanks everyone for another wonderful episode. And my special thanks um, to Dr. Lalit Sodha, as well as for Dr. Anjali, Sharon, of course, bringing the guests, Samita ji, Lata ji, Sam, Dr. Naveen Gupta, and all the other guests who have been a part of this episode. And we look forward to see you all for the next episode for the menopausal care at Glow Women. Let's wind up today's episode with a short Gayatri mantra. Om Bhur Swaha Tat Savitur Varenyam Bhargo Devasya Dhimahi Dhiyo